For nursing mothers or soon-to-be mothers, we did want to flag that there is a new lactation suite in the Humphrey Building located on the 7th floor. So please reach out to an OHSEPR or ACF team member to assist you and direct you to the right location. We're really excited about this new suite. We can go to the next slide. Few housekeeping items. First, as you all know, if you're a non-federal employee, you must be escorted at all times. There's a cafeteria here. We have restrooms behind the drywall as well, to the right of me here behind the stage here. As well, we're asking folks to please silence your phones and ensure that there are no distractions. And if you do need to take a call, please head over to the East Wing. Lastly, we do have some ASL interpreters here today to support. In addition, we have some graphic artists in the back capturing all of the insights for this event to really capture the vision and the visuals here. So thank you again. Let's go to the last slide. Safety. If there's any emergencies, we really hope that you all will follow the evacuation route here. So if you hear an alarm, please remain calm. We are here to support you and we'll make sure to help you transition out of the building safely. There are 5 exits leading directly outdoors located on this floor, and we'll ask you to check into your convening booklet for more details there. So without further ado, really excited to kick off this event and stay tuned. More to come. Thank you. We can have the first panel, please begin to line up. Appreciate it.
All right. Colleagues, good morning. My name is Natalie Grant. Good morning again. That's okay. Yeah, there we go. There we go. My name is Natalie Grant, and I'm the Director of the Office of Human Services, Emergency Preparedness and Response here at the Administration for Children and Families at the U.S. Department of Health and Human Services. It's my pleasure to open this convening Forward Together, Shaping the Future of Disaster Human Services. As we open, I want to begin with gratitude, first and foremost, to all of you, as over the previous 6 years, you've shared your personal stories with the OHSEPR team that have led us to this point where we can curate a platform to amplify the conversations that you have started. So over the next 2.5 days, those conversations will come to life through your personal experiences and those of the disaster survivors you've assisted. Without your unwavering commitment and affirmative engagement, none of this would have been possible. As you can see, next slide, from this agenda, we have a robust dialogue across the critical issues facing human and social service providers in disasters. Today, we will begin with the perspective from our political leadership in their stewardship of ACF programs. Then we will hear from state human services leaders on their perspectives from recent disasters. Following a break for lunch, we will learn how federal program managers are tackling the important issue of equity in disasters. And then we will conclude the webinar and have roundtable discussions in the room. That's a lot, and we have a lot more over the upcoming days. You'll hear more from me later on, but I'd like to advance the slide. And now I'll pass the virtual microphone over to Jeff Hild, Principal Deputy Assistant Secretary for the Administration for Children and Families.
Good morning, everyone. I'm thrilled to welcome you as we gather to discuss a variety of topics related to human services in emergencies and disasters. Thank you so much for being here. I want to recognize our colleagues who are unable to join us this week as they are managing ongoing response and recovery missions in their communities. And please know that we are keeping all of them centered in our hearts and minds over the forthcoming days. My name is Jeff Hild, and I have the honor of serving as the Principal Deputy Assistant Secretary at the Administration for Children and Families at the U.S. Department of Health and Human Services. And our goal at ACF is to promote social and economic well-being by meeting individuals, households, and communities where they are and providing the programs and services that enable them to thrive. And ACF supports people experiencing crises daily. Emergency responses have become more prominent in our mission portfolio as the frequency, complexity, and severity of disasters have grown and impacted our program and service networks. And over my time at ACF, I've had the opportunity to travel across the country and meet with service providers and recipients from Washington State to Georgia and New Hampshire and lots of places in between. And I've seen firsthand how communities are navigating the aftermath of disasters like hurricanes and wildfires, while others are confronting the challenges of changes to their home and natural environment due to extreme heat or coastal erosion, altering the landscapes of where we live. And this spring, during a visit to Alaska, I talked to domestic violence providers whose shelters in remote parts of the state were becoming unusable because of permafrost melt and climate change-induced erosion. In a different way, the COVID-19 pandemic altered the landscape of our daily routines and how we deliver services to the people and communities we serve. Providers in every community were thrust into adapting and innovating to ensure service continuity. Many were implementing changes like fully virtual case management for the first time and under very difficult conditions. And upon reflection on this time, it's clear to me that everyone leaned into that challenge and found a way forward. And that's an important part of what this convening is about and why we're here today, to share our experiences and promising practices, to build strong communities of practice through our conversations, and to identify how we can act through our partnerships, programs, and services to address future challenges and enable positive outcomes. Each day, the speakers and discussion will focus on topics that reflect the critical issues confronting human and social service providers in managing disasters and emergencies. And we'll have the opportunity to challenge each other to consider what equitable service delivery in a disaster means to historically underserved or marginalized communities, or how trauma and mental health can impact both the service provider and the disaster survivor. We will learn about opportunities ahead and data sharing that can help ensure survivors receive the right services to address their needs holistically and in a timely manner. And these topics reflect our unity as a community to provide human services in disasters, engage ideas to empower strong and resilient communities, and inform how we chart the path forward together. So I encourage you to bring your knowledge, your expertise, your experience, your questions to this discussion so that we can all seek understanding that will enhance our ability to identify solutions. And I also encourage you to keep the disaster survivors in mind as you engage in your discussions and brainstorm solutions. I know you have an ambitious agenda ahead, but there is a lot to discuss. And so before transitioning to the next speaker, I want to thank the OHSEPR and contract support teams for your work within our agency and in partnership with each of you to bring us all together for this important discussion. If your experience is seamless, please know that many people worked behind the scenes to make that happen. And in closing, I wish you all much success over the forthcoming days. I certainly look forward to hearing the readout following the convening. And now it's my pleasure to turn things over to my colleague, Deputy Assistant Secretary for Policy, Jen Canestra, to lead our first panel of the day. Thank you. Morning, everyone. I'm thrilled to
Hello, everyone, and I also want to extend a warm welcome to those who are joining us virtually, as well as those in the room. I'm thrilled to be able to kick off this convening with our first panel. To start off, my name is Jen Canestra, Deputy Assistant Secretary for Policy at the Administration for Children and Families. And again, we are thrilled to be able to have this conversation with all of you. During the next 30 minutes, you will hear from this distinguished panel of federal speakers about reflections on recent crises and disasters and lessons learned, policy changes that we implemented because of these lessons learned, and then also speaking to challenges that remain and what we are doing to address those challenges. When ACF decided to have a new strategic plan back in 2021, we had extensive conversations with stakeholders and with experts with lived experience, and it became very clear that one of the 5 goals of our strategic plan would be about the intersection of human services and emergency management. And so goal 4 is about supporting communities and families who are facing crises and emergencies and how we can promote resilience. And this panel, using an equity lens in the work that we've done, will discuss some of that work and how we are trying to advance this goal. So it is my pleasure to introduce the federal panel. We have Director Ann Flagg of the Office of Family Assistance, Commissioner Tangela Gray of the Office of Child Support Services, Commissioner Rebecca Jones-Gaston of the Administration on Children, Youth, and Families, Deputy Commissioner Hope McDonald Lonetree of the Administration for Native Americans. And then virtually, we have Director Kari Garvin of the Office of Head Start, who will also be joining us. And I will start off by turning to you, Anne, if you could give some reflections on the Office of Family Assistance work.
Yeah, great. Thanks, Jen. So first of all, echoing big thanks to Natalie and this team, because it's spaces like this and communities of practice like this that have accelerated my own thinking, advanced my own thinking in our role as human services providers. You fix me up here? Okay. All right. Takes a friend. Takes a community up here. Yeah, thank you for creating this space. And certainly thanks for inviting us in it. So as Jen said, I'm the director for the Office of Family Assistance. So most of you probably are familiar with the Temporary Assistance for Needy Families program, TANF. This is the program designed to meet sort of the financial shocks that families might feel, and that can be for any range of reasons, including disaster. But what I think we all know is that families that have the least resources, individuals, families, and communities that have the least resources are most vulnerable to impacts of natural disaster. And so, we need as many tools in the toolbox to make sure that we're meeting the immediate needs of the family with our prevention framework, right? Before those needs really turn into, ongoing sustained crisis for families. And so, I kind of think about this because of you smart people in sort of the response, recovery, resilience frame, so thinking about how TANF can be leveraged as a tool in the immediate moments really is one of the more effective response tools out there because it's cash. Right. So families, we can give the opportunity for families to identify specific need, give the flexible resources in order for that family to meet that need. And you know, the human services system is like not bad at getting cash out and other resources out to families when they need it quickly and efficiently. So leveraging resources like TANF, which can also, by the way, be braided with other federal sources like FEMA dollars to provide an ongoing bridge, is a is a really strong tool out the gate for serving families and communities that are impacted by disaster. And the other thing I'll note is, you know, that we learned a lot about cash in particular during the pandemic. And you know, all the research that's been done is that, you know, families spend money on the things that they need. They spend the money on basic necessities, on, you know, restabilizing, you know, restocking the shelves. And you know, families use cash in the way that is, you know, meets their individual need and their specific context. So incredibly valuable. So when we think about sort of the recovery, the recovery phase, when I think about TANF, the role of a program like TANF, you know, that's the point where we got to make sure families have all they need to restabilize. So we need to use TANF dollars to think about making sure childcare is accessible to all parents who are trying to get back into work or families that are trying to get back into school. You know, we can bolster these supports so there is a smoother landing post-crisis into, you know, into sort of a new normal maybe. And then when we think about resilience, you know, this is the area I'm most excited by, and I think probably one of the harder things to think about, because it does require some amount of sort of vision into the abstract, some thinking about what you know, what the future holds and how we can match these opportunities around resilience with the families and individuals who are often not able to access the resources, including job training, to, you know, sort of catch on to these emerging industries. So in thinking about resilience, a couple things come to mind. And we just had the opportunity last week to visit with a service provider in North Georgia who is working with a whole bunch of federal resources, including TANF dollars, to create training for families who would be otherwise eligible for TANF or another social services program to learn how to become EV techs, right? Fix those stations. And, you know, these are jobs that both, you know, are aimed at mitigating the climate crisis, but also have the potential for a six-figure salary for a person with pretty limited amount of training time. So these are the kinds of opportunities I think we're looking to expand on. And you know, as I started with, and we trust this group to help us think through and see around the corners to those emerging opportunities that we should be considering at the federal level. So thank you so much.
Tangela, we'd love to hear from you now.
Right. So good morning. Again, my name is Tangela Gray. I am the Commissioner for the Federal Office of Child Support Services. I too want to give a big shout out to Natalie for including child support in this conversation, especially in the month of August. It is Child Support Awareness Month, and we support green if you haven't figured that out. I do want to just tell you a little bit about the child support program quickly. For those that may not be familiar with it, we definitely partner with our state, tribal, and local agencies to develop, manage child support agencies in 54 states and territories. We also have communication and support with child support programs in other countries. Our role and responsibility is to ensure that our state, local, and tribal child support programs are in compliance with rules and regulations around the services that have been clearly identified in our overarching legislation. We take pride in making sure that we provide guidance and technical assistance. And then I too come to this role with a lot of experience at the state level. I, like Ann, we learned a lot about the pandemic, and the child support program, just like many of you all, had a lot of major impacts, not only just to the workforce, but to the services that we provided. And so I'm happy to report that coming into this role as commissioner, we have received an enormous amount of support from the department and ACF as it relates to the impact of the pandemic and the human disaster services on the child support program. As such, on March 4th, we were able to get a final rule across the finish line. This final rule modifies performance standards for the child support programs. And what that does is it provides the child support programs with an opportunity to continue to provide key services without any type of failure of benchmarks and financial penalties. This is huge for the child support program. When we have people that are dealing with pandemics and disasters, the last thing we want to do is impose some type of financial penalty on the state program that prohibit us from providing services to our disaster survivors. If you're not familiar with those performance indicators, just really quick, it really impacts the opportunity to provide services for those around current support, arrearages, and fraternity establishment. ACF was already up and operational in modifying the performance establishment performance indicator. We did receive a time limit relief on that particular indicator for the state child support programs. But this rule provides an opportunity for the secretary to waive those type of requirements should we have public health disasters or emergencies in the future. So much so that it doesn't have to just depend on just the governor declaring a disaster. The state or a county can also declare a disaster with this performance modification opportunity. I do just want to quickly mention as well how critical it is for the services that we provide to child support parents, including non-custodial parents, custodial parents, and then the children that are receiving support to benefit from this final rule. It definitely, as Jennifer mentioned, provides our program nationwide with an opportunity to provide acute services to those that are in need. And so I cannot stress enough how thankful we are to be able to have this final rule across the finish line. We've had the temporary relief prior to this rule. We now have the final rule that actually addresses any type of natural disasters and calamities in the future. So thank you again for this opportunity for sharing this with you. And we continue to look for ways to support our families during these type of situations.
Good morning. Thank you. I'm Rebecca Jones-Gaston, Commissioner for the Administration for Children, Youth, and Families. And we hold within our administration the Children's Bureau, which oversees child welfare, and the Family Youth Services Bureau, which has runaway and homeless youth programs, as well as adolescent pregnancy prevention and positive youth development. And so our programs are serving oftentimes people who are already in crisis. And so I think that's an important a nuance in the conversation here. Back when Katrina hit in 2005, we learned a lot of lessons federally. And the Children's Bureau started now requiring within its 5-year plan for its 4E agencies to require that they include what their disaster plan is for the work, so that we have some awareness at the federal level. And we also, the Children's Bureau also put out a Dear Colleague letter that I'll reference in a little bit, but really to remind us about the many things to think about as we are responding as human services to disaster and emergencies. The Family Youth Services Bureau, again, with the Runaway and Homeless Youth Program particularly, has done work with the Psychological First Aid Program and making sure that its grantees are connected in that way to really explore in advance of an emergency. What are the things that they need to have in place as organizations in responding to disaster? I want to talk a little bit about my connection in this conversation. I was absolutely delighted when Natalie asked if I would participate in this panel, and she probably thought it was a little weird that I was excited as I was. But think about my own journey. I'm a social worker, and so my first experience of a natural disaster in this space was really with Katrina. And it was on a personal level where I had 13 family members suddenly move up to my house. Uh, and went into absolute social work mode. But I learned a lot in that space and applying to my own work and thinking about, how do people access this if they don't even know where to go and where to start and all of those sort of things. And then when I was a child welfare director in Oregon, in addition to the pandemic that we were navigating, we suddenly within that first year also had record-breaking fires across the state. And my knee-jerk reaction was to immediately call and ask my local directors, where are our kids? And where are the foster families and what are we doing? And was reminded that, hey, we're actually also evacuating. And I took that, and also that was probably my response to the federal office that called me in the immediate to say, what's your plan? Is it activated? What are you doing? That there's a need for some space and grace. And I know you'll hear from colleagues a little bit later. But I think for these systems, and speaking for the ones under my umbrella, there are already systems where communities are disproportionately impacted by our intervention in an emergency on a day-to-day basis, right? And so when disaster is experienced, that disparity gets exacerbated exponentially. And so I think it's really important to be able to do planning when you're not in the heat of the moment, to really think about how you're intentionally going to disrupt that tendency to just automatically kind of follow your regular state of business when we know that that regular state of business disproportionately impacts communities of color, tribal communities, poor communities, and we're navigating people who are already separated from their people, runaway and homeless youth, not connected to family, children who are separated from their families in foster care, and then foster parents and our staff that are navigating the emergencies as well. And so just really encouraging folks to take advantage of the pre-planning and learning from the lessons and continuing to be in the space at the federal level, but also at the state and local levels as well. Thank you.
Good morning. Yat e bine she e hope McDonald Lone Tree Yinshia. Toda chitni nishle hashkahat zo bashachin na atlane edishache arobet ane edishanella. I am Navajo, and I am the Deputy Commissioner at the Administration for Native Americans. I am so happy to be with you today because this is a very important and often urgent topic that we are covering, topics, I should say, throughout the next few days. And so I greatly appreciate my colleague, Natalie, who has been working very diligently with our office as well as other tribal communities. And so I'm happy to be with you here for a few minutes this morning and share a little bit of my experience and what we do at ANA. So ANA, even though we are in the family of ACF, we are primarily a grant program, so we are not direct human services. We were established in the early 70s during the War on Poverty, and at that time, grants were disseminated across Indian country to help tribes with socio and economic conditions within their communities. And that was so successful that at that time, Congress passed the Native American Programs Act and created the Administration for Native Americans. So the bulk of our grants are to address economic development conditions in communities, as well as preserving Native languages and environmental regulatory grants as well. So we because we're primarily a grant program, that's the way that we are going to be responding to emergencies here at ANA is with our grantees to make sure that they are okay, to make sure that we are connecting them with appropriate services or helping them identify what we can do to help them take a pause on their grant with their projects, whatever it is that they need. Personally, I came here to ANA during the pandemic, and I don't know how many of you started your job in the middle of a pandemic, but it was very interesting to oversee an administration or a program virtually as the first year or two. When I got to, before I got to ANA, I was working with the Navajo Nation during the pandemic. I was on the ground during that time. I will tell you that it was the most surreal experience I've ever experienced in my life. It was very hard to be on phone calls every day and to learn of another colleague or relative who was passing due to the pandemic. So when I say that this is an important and urgent matter to discuss emergency preparedness, it is even much more important when we're talking about the indigenous populations here in America. So I feel like Rebecca just kind of teed up my comments because she said something that was very important, and that is that it's really important that you are reaching out to identify who your connection would be within these tribal communities early on and establish relationships. There's no success and there's no comfort in establishing a relationship in the middle of an emergency. So I want to ask the people here today, if you want to raise your hand, if you have a direct connection to a tribe within your area or region. Okay, I see a few hands, so that's good, but that means that we have our work cut out for us. If you have tribal communities within your region, it's really important that you connect with them early on. Many of these tribes have different relationships with states and their neighboring border towns. So it is important that you connect with them early, identify who your point of contact is. It is also very important because when you are dealing with tribal communities, that you are reaching out to somebody who can help you with cultural sensitivity. Many of our communities still practice their traditions. Many of our communities, like Navajo, we still have people who are fluent in Navajo and some whose first language was Navajo and some who do not understand English and only speak Navajo. So there are not only cultural aspects that you need to be aware of, but also language barriers. And during COVID, because of that on Navajo, we had to develop new words, new medical words and new medical terms for COVID. And that was also something that had to be developed immediately and quickly to get out. The other thing that I wanted to share with you that many of you may or may not know is that because of the specific environments or situations that our communities, our tribal communities, many of them may not have broadband. They may not even have phone service. And so it is really important to make sure that you know when you're developing your connections of how you're best going to be able to reach everyone in that region. When I was at Navajo, we had to do conference phone calls at that time in various regions and try to get local leaders and people together by phone to be able to reach them with information and answer questions. What I most appreciated during this time was that the White House reached out to tribal nations and they had weekly phone calls with the tribal communities and tribal leadership. They had various leaders from federal programs to answer questions. All of these are critical in developing a sustainable way of communicating and engaging and making sure that you're going to do it right. Because one of the things that you're going to discuss later on, I think it's on day 2, is trauma. And as Rebecca spoke a minute ago, that many of these communities have been impacted by historical trauma, and the trauma is deeply embedded in many of our communities. And so it's really important to understand that this, when she used the word exacerbates, when these emergencies happen within our communities, it exacerbates everything that had already been going on, whether it's violence or people who are missing. Those are all issues that we continue to face on a daily basis, but during an emergency, it is critical that we have all hands on deck. So I appreciate the time. I don't know if I went over, but I appreciate the time that I was given here to share a little bit with you. I'm happy to answer any questions, and I will be able to pass out my card if I could be of assistance to any of you. Thank you, and a
And now, Kari, we would love to hear from you as well about the Office of Head Start.
Well, great. Good morning. Can you hear me okay? Yes? Great. All right. So good morning, everyone. And thanks so much for the opportunity. Thanks to Natalie as well. I'm experiencing what some refer to as FOMO, fear of missing out, because I'm not there present with you, but just couldn't be there with you today. But to Natalie, again, thanks so much for extending the opportunity to Head Start to be a part of this conversation as well. Head Start's been around since 1965. We administer services in all 50 states and many U.S. territories to children and families from who are furthest from opportunity. And much like what Rebecca said in her remarks, our programs operate in many communities that are distressed already, even before a disaster strikes. But what I will point out to you here this morning is that, and what's important to understand about how we engage when disaster strikes, is that Head Start is a federal to local program. So in other words, we administer grants to individual agencies, in fact, 1,600 or so of them, directly from the federal government to the local level. And through those grants, we serve about 800,000 children in all of the states and the territories that I mentioned. And so what's important about that federal to local structure is that it really does expand our ability to engage when disaster or crisis strikes. And we don't have to coordinate all of that effort or manage it all from Washington, D.C. We rely heavily on the 12 regional offices around the country that are more proximate to the local programs when crisis or disaster strikes. And so we have the ability, I think, to mobilize a bit more quickly, and that serves us well since the program is so spread out. And so, and really and truly, our Office of Head Start regional offices, they sometimes hear about local disasters and situations before we do here in Washington, D.C. And so really that, again, sort of expands or grows our ability to respond. We broadly define disaster. I'm sure we share the same view of it, but I just want to just name them very specifically. So we think of disaster in terms of catastrophic natural events or significant health events like, hurricane or flood or wildfire. Most recently, we've had to engage with Hurricane Debbie and now Ernesto. You might recall the Maui fires, Lahaina, Hawaii, and we did manage and engage there. And then, of course, COVID-19 pandemic. All of these things and things like those are some of the issues that our programs will face, and that will certainly provide support to, not just to the children and families that we serve, but also to the staff as well, who are embedded in these communities and who are subject to and vulnerable to the effects of disaster as much as the children and families that we serve. We also include in our definition of disaster man-made disaster or man-made crises like shootings, for example. Top of mind, I mean, they're all horrible, of course, but this even includes, unfortunately, 2 years ago now, the Uvalde, Texas incident, which for us in Head Start actually had a secondary impact on local programs. Secondary in the sense that is that whereas the shooting did not happen specifically at a Head Start program, there were many Head Start staff who had previously served children who were and families who were involved in that incident. And so, again, we still respond in many, many ways. And I'm going to kind of walk through those now. So for us, when we engage as an office, when disaster strikes, we really address disaster really in three phases. So preparedness which really is the front end. And it's really all that we try to do to actually support programs' abilities to inoculate against disaster to the extent that they can, really being ready with facilities, with access to resources and equipment on the front end. And also, I've heard my co-panelists talk about awareness and being aware of resources that are available right there in the local community. And so that's something that we push hard, and we believe that is a critical part of really the second part, which is a response. And I'll say more about preparedness. I'll loop back to at the end of my remarks to say really how preparedness serves us. It serves us well, of course, on the front end, but also the lessons learned from the past actually help programs and communities to prepare for future or upcoming events as well. So we have preparedness, we have response, which of course, pardon me, response, which includes the resources that are brought to bear, financial, human, assets, all the resources that are brought to bear to actually provide, of course, support as programs and communities and children and families and staff are trying to rebuild. In the name of response, we prioritize emergency funding for programs that go beyond their base grant funding that they receive for their programs to help them do all sorts of things. I mean, again, to repair facilities if that's needed, we deploy mental health services when needed. We did that in particular with, or most recently, I should say, with Hawaii with the Maui wildfires. And we also, and then recovery is the next phase, which has everything to do with the actions that are taken from the time that emergency hits until all the needs are met of staff, children, and families. And so all of that really falls into the recovery period. And really, we continue pressing on that until such time as all who are affected can resume their daily activities pre-disaster. And so, again, that includes the deployment of mental health resources as well as infrastructure supports to bring that community and bring that program back to functioning the way it did prior to the disaster. So the last thing I will say, I'm not sure how I'm doing on time, but the last thing I'll say, at least in this moment, is to go back to that idea of preparedness and what we've learned and how what we learn equips us for the next disaster. So for example, we operate programs in the Great Island of Puerto Rico. We also in the Virgin Islands as well, and those islands are vulnerable to hurricanes much more than anywhere else probably in the United States. They get ravished by hurricanes over and over again. And so what we've learned in terms of preparedness is that as we award new grants on the island, or as existing grants are making plans for the upcoming years, they rebuild their facilities in better ways. They build their facilities in ways that are obviously are better resistant to storms, but B, that they sort of repurpose the facilities so that they can serve as not just a shelter, but a hub for the community when disaster strikes. So now certainly you have Head Start facilities that primarily serve children and families, but have industrial kitchens so that food can be prepared for the community and not just the program, or adult bathrooms with showers in them so that it can be a resource in that way for families in the community who might have need as well. We've also learned through the pandemic about how our services can continue with food distribution or remote education services and so on and so forth. So we just learned some important things that really just feed into or roll up into our preparedness phase as we continue to get ready for the next cycle. So again, thanks for allowing me to share, and I will turn it back over to our moderator.
Thank you, Kari. And I just want to extend thanks to our panelists for your remarks and your insights and your suggestions and your commitment to really working with the communities, working with states, working with all stakeholders to address crises and emergency management situations. And to close off, I just want to say, thank you to everyone in the room and everyone listening. If you heard something and you have questions, or if you have suggestions, a lot of the policy changes and regulations that our panelists mentioned came directly because we heard feedback. You told us what we needed to address, and we worked to find a solution. And we don't have that unless you tell us. So please reach out if you have questions about what you heard about, or if you do have suggestions. And again, we're super excited about this 3-day conference, and thank you again.
Thank you, everyone. So our next session, Understanding the Dimensions of Disaster, Perspectives and Experiences from State Human Services Leadership, will be moderated by Terry Ricks. So let's give him a round of applause.
Good morning. I cannot tell you, I think someone mentioned excitement about such a convening, and I sit in that space. My name is Terry Ricks. I am the former Secretary of Louisiana's Department of Children and Family Services. I am an attorney and also a consultant. Right now, I'm doing some work for the Administration for Children, Youth, and Families. And so being able to work for many years in the state of Louisiana has given me the type of perspective on this event that maybe not everyone would have. I've worked at that department 3 different times in my life. When I first finished college, I was a front level eligibility determinations examiner. Later, after law school and working for the Housing Finance Agency, I returned as undersecretary under Governor Blanco. This is when Katrina happened. I was the undersecretary, and I was the person who was in charge, the executive in charge of ESF 6, that is housing, sheltering, and human services. I can't imagine where I would be in understanding what we're talking about today if it were not for that experience. I appreciated Commissioner Jones-Gaston spoke about it from her perspective. Personally, I have it from every aspect from Katrina, and appreciate the changes that started being made at the federal government and in the state government from all that we learned from so many people's pain during that time. Since that time, I came back to the agency under the past governor, Governor Edwards, served as deputy secretary, executive council, and then secretary. I want to talk to you just a second about doing things differently, because we are, and all of us in the state and the federal and local service are responsible for really all hazards. I think most of the time people think about Louisiana and we think about hurricanes mostly because of Katrina. But I would like to talk to you about 2016. In 2016, we had massive flooding that had no name. There was no name to it. And so a lot of people didn't even realize what was going on. But in both March and then later in August, there was such massive flooding in Louisiana that had probably about 25% of the staff of 3,600 in the Department of Children and Family Services that were displaced. And so providing services during that time got to be a little bit difficult. There was an article in the Advocate, which is our local newspaper, that chronicled a child welfare worker in Louisiana standing in calf-high water in her own house, calling her caseload to see where the children were that were in foster care. That happened about 5 months after we took office. Immediately, we decided we needed to make some changes. And I am so grateful to know that we have federal partners like the panel that was before us. Would you guys please give the federal panel another round of applause? I am elated that we have such people working for us. And did you notice the number of them that have state service? They not only hear the concerns of the state, they brought them to the federal office, right? And so when I think about now what Natalie has done and her staff of listening over the past 5 to 6 years about what happens with the human services workforce, that should be a part of the assessment going on in a state when there's an event, and it's an all hazards event, right? So we made changes to immediately use two-way texting with all of our family members that are all of the foster families, and then all of the employees. So immediately I could get a count on where everyone was. Now, that was something that would take us days before. So we made a change. But then we decided that our federal partners were also important. So every time there was an opportunity to talk, we talked. And what I can say about this administration is they've been listening, but not just listening, they've been acting. So this strategic plan that came about was amazing. So thank you for being here today. I want to share with you our panel. And so next to me, we have JR. I was supposed to do this already. Anton Bland, who is joining us from California's Department of Social Services. Next to him, we have Ed Flick, the director of Oregon's Department of Human Services. Then Trista Spear, our deputy director of the Hawaii Department of Human Services. And last, we have Joseph Campos, the deputy director of Hawaii. Now, what's important about this group? They're working together, they're experienced, and they're here to talk about their experience of moving forward together. That's why we're here. We know that we can't do this by ourselves. And when things change, like they always do, like in Louisiana in 2023, we got wildfires. What? We do water. We didn't do wildfires. And so now everybody's doing wildfires, and we all need to be prepared for that. And so I invite you to listen in to this group who has such amazing experience. And the best thing about them, from what I could tell in my conversations with them, is they're ready to share and they're ready to work together. So let's get started. JR Anteblin.
Good morning. Thank you. I'd like to first thank Natalie and Byron for inviting me to present here today and for convening. So thank you. Again, my name is Jaron Tavley, and I'm the Chief of Disaster Services at the California Department of Social Services. My branch oversees the statewide coordination of ESF 6 Mass Care and Shelter. So today, my topic is Disaster Case Management Program, which, for those of you that are not aware, that's the federal program that we at CDSS oversee when there's a major presidential disaster declaration with individual assistance. So in California, right now, we currently are overseeing 4 separate DCMP grants totaling around $55 million. So DCMP for us has been a really big topic, as almost every year we're receiving at least one DCMP on average. And I'd like to talk about some of the challenges that the DCMP program faces or that we have seen in California, because I know some states do it differently. So I'm here to talk about what we've experienced. So when it comes to DCMP, we do it, well, we work with a local NGO to provide case management services throughout California. And with California's vast geographical area, sometimes one of the more difficult things is finding service providers that can help somebody in San Diego County all the way down to the south, but somebody that can also be helped in Siskiyou County all the way up to the north. So some of those challenges we face by working with NGO providers and then subcontracting those out additionally to other providers. I remember when I started 4 years ago in this position, the biggest challenge that we had seen was the funding. When we apply for FEMA funding for DCMP, when there's a disaster declaration with IA, we start on the application immediately. And when you apply for those grants, it usually can take between 4 to 8 months to hear back from FEMA on whether one you've accepted, because I know with California, our DCMP's awards are larger. Ours vary from, I believe, $6 to $20 million. And at those sizes, they require congressional approval. So that's why ours take a little bit longer at times. And it's helping the disaster survivor, because that's ultimately what our goal with disaster case management is to help the survivor. And when we first started looking at the program in 2020 with our fires, we had 2 DCMPs. We did the application, we waited for the grant to come through. And at this point, we were about 6 to 8 months into the disaster or past the disaster declaration date. We then got the money from FEMA. We then worked with the NGO providers to start hiring case managers. And at this point, we're now close to 1 year into the disaster period of starting. And at this point, I'm sure if I was a disaster survivor and somebody came to me a year later and said, "How can I help?" I think the first thing I would have said is, "Where were you a year ago?" And that's fair. That really is fair, to be honest. And so one of the things we've looked at in California is how can we help the disaster survivor closer to day one? And so what California has done is, while we know when we find out that there's a major presidential disaster declaration and that there's going to be IA and that we're going to be applying for case management, we pre-fund the program. So once we know that we're going to apply, we estimate, let's say the program is going to cost $10 million. We'll start using state dollars to then have those case managers there. In California, our most recent disaster declaration with IA was San Diego County. That event, I believe the event happened somewhere around February, March of this year. And when the DRC, the Disaster Recovery Center, opened with FEMA and the states and the county, and the state and the counties, we were able to have our service provider sit in the Disaster Recovery Center and start registering people immediately. Were we able to provide them a case manager on day one? No. Is this the best way? Are we looking at how we can improve this year after year after year? Yes. But the more important part is that we were able to start registering, because the problem is a year later, not only is giving these services to the disaster survivor hard, but it's identifying where are these disaster survivors a year later, and being able to have somebody in the Disaster Recovery Center start registering and get that information is one of the best things, I think personally, that we could do to at least start understanding who those disaster survivors are, get them pre-registered, while we then fund the service provider to start hiring and staffing up people and identifying resources that could be necessary. So thank you very much.
Thank you. I appreciate, bringing up some partners there, FEMA, talking about funding coming in different places in the state, leaning in, knowing that it's responsible for helping its people first. Yeah, thank you.
I'm not sure this is a club that other states would really want to be in. I think if we had, Florida and Texas, I think we'd have a trifecta here. Again, my name's Ed Flick, and contrary to the slide, I'm not the director of Oregon Department of Human Services. I'm a director of an office within that department. Frankly, that didn't exist 4 years ago. In fact, my first day on the job, Rebecca already described it. 500,000 Oregonians were evacuated across 12 counties, I think. And that was right on the heels and in the middle of COVID. So the day I started was a challenging day. I came to that having spent about 18 months at Oregon Health Authority doing COVID. Before that, I was a county emergency manager. I only have a couple of minutes. And so I think my message is really one of appreciation to ACF to recognize this really important emerging part of this emergency management practice. I think the day that I had, having been an emergency manager and coming into this unprecedented situation, the framework ACF is working on, I think, can help other people in my position not have that same first day. Because the people we serve shouldn't have to wait for us to get organized. Oregon has made an investment in human services emergency management. My office has 40 full-time employees. We're also really large. It's a state-delivered system. I always wondered why, how we differed Californians. I first went to JR and I said, hey, how does this work? So we've got a regional staff, and our job is to support the 9 federal tribes and 36 counties. And I think to do that, it's really important that we are the bridge. You know, my wife's a social worker, and she's influenced me in a number of ways. And this idea of micro, meso, and macro. I think that we're at the intersection of micro, which is families and people, and macro. And here we are in DC, right? And I think our job is to do exactly what the last panel said, is we should share the perspectives we have as states. The systems that exist now, I mean, I think it's almost a cliche, but they're not person-centered. And our professional association of public human service agencies talks about the human services value curve. And I think really what ACF is doing is describing a practice that can help us get to generative work. And I think my job is to understand the needs of people, the micro, to tell y'all that work at the macro how to resource the meso, because states really are suffering, right? There's conflicting frameworks we work in. JR talked about it, right? FEMA and HUD have particular abilities to assist communities that aren't necessarily really that linked. And the states find themselves in the middle of those, and they have to find workarounds. So I'm really anxious to hear more about the innovations that are occurring here at HHS. I'm really proud to be part of this emerging part of our profession. We're coming off 7 weeks of activation in Oregon. It started out with unprecedented heat. More people die in Oregon from heat than anything else. And it affects our seniors and those least able to cope. And then wildfire just nipping at the heels of towns across Oregon. So we really are in a position of not just the big notable and notorious incidents, but really what's become an environment of chronic emergency. And a lot of our Oregonians are in a state of emergency every day. And so we want to figure out how to address both the disaster caused circumstances and what I think the framework refers to as the exasperated circumstances. So I'm here to listen and learn and share Oregon's perspective.
Thank you, Ed. Tristan?
Good morning. Is this on? Yeah. Okay. Good morning. Thank you everyone so much. And to echo the first panel and the speakers previously here today, thank you to Natalie, to Byron, to ACF, and to OHSEPR for the invitation to be here. Like Ed said, very proud and honored to be part of this group, this collaboration, and this convening so that we can all continue to grow, so that we can all keep going and continue to provide more effective, efficient services as soon as possible for survivors of disasters. And going back to one of the points, well, let me back up and take a half step back. Good morning. My name is Trista Spear. It's just, I just jump in. I want to keep going. I am one of the deputy directors for the Hawaii Department of Human Services. I joined the Department of Human Services on August 2nd of 2024, along with just, well, yes, it's been a year, to 2023, and joined Joseph Campos as a deputy director for the agency. Prior to me joining, the agency had only had one deputy director for a number of years. And as you may be doing the math, 6 days after I started, the Maui wildfires happened. So I didn't start 48 hours after the fires as Ed did in 2020. I started 6 days before. I ensured that I had on Monday, the day before the fire, something in my gut said, don't leave until you work with IT so that you can log in remotely to work from home. But you know, my background and experience before joining the Department of Human Services largely has been as a prosecutor and an attorney. I'm also an attorney, and part of that time serving as a prosecutor was actually in Multnomah County, Oregon, for a number of years, and I specialized in child welfare cases, delinquency cases, and dependency cases. So I understood the work of the Department of Human Services, and very much that work is crisis response. And the reason we're all here today is because it's adding the disaster response aspect to that crisis response. And I, unexpectedly had the experience. I still resided in Multnomah County at the time of the 2020 wildfires. So I remember living through those fires. I have friends who lost their homes in those fires. I remember driving to work. For those of you who have maybe been to Portland or seen, as it's often called, Bridge City, you couldn't see the courthouse coming over the bridge because of all the smoke that far north of those wildfires. So when August 8th, 2023 happened, I had a very personal experience that I brought into it, like many of the other panelists here and many of you. Even a few summers before that, when the Gorge fire happened, I was one of the last cars, unbeknownst, my husband and I, driving from Hood River back to Oregon. And I remember those few fleeting moments when we were stopped on 84, and I looked up to my left as the flames licked down the canyon to the freeway, and looked to the mighty Columbia River to my right and thought, if we don't start going, we're going to have to start swimming. And I share that because it was that intrinsic motivation immediately, to JR's point, how do we provide assistance as fast as possible? And Joe and I immediately, with the director of then Director Kathy Betts, jumped in and decided, how do we help our community? How do we respond? And so the Department of Human Services, at the direction of Governor Green, jumped in within the first 24 to 48 hours. We responded to Maui. We're happy to talk about a lot of that today. But one of the things, to JR's point, how do you track those survivors? So we immediately leapt to action, utilizing legal training and skills, identified the need for data sharing agreements and getting those drafted very quickly so that they legally would hold up. Given that I had recently just transitioned from the Attorney General's office in Hawaii, I was able to very quickly navigate that. And we immediately, within I think 2 weeks, had data sharing agreements in place. So before Labor Day, we were already part of the data sharing agreement with FEMA. We were part of the data sharing agreement with the Red Cross. So we were able to immediately start tracking those survivors so that we didn't lose anyone. So we made sure no one would fall through the cracks in receiving vital support, shelter, food, water, and other wraparound services. Deputy Director Campos and I responded to the War Memorial. We assisted in transitioning folks into shelter services, innovative approaches, and we utilized leveraging Ed and JR and our introduction to those two individuals and Oregon's experience, California's experience, and we kept going. We used their playbooks, their information, and we grew from there. And we were able to submit our disaster case management application within 6 weeks of date of incident, within 2 weeks of learning of that program and even what it was, and that it was, as Gen Z says, a thing. And we actually got the award by November. We utilized private funding for an interim program to get services before we were able to access those federal dollars. And we just received an additional supplemental funding. So we now have a $25.2 million disaster case management program 1 year out.
Thank you, Trista. Thank you.
Aloha, everyone. Joseph Campos, Deputy Director, Department of Human Services, Deputy from September of 2020. And I was very happy that in August of 2023, well, in January through May of 2023, we were able to convince the legislators to provide us a second deputy. And had I not had Trista as the deputy, I don't know what I would have done. I was asked to talk about risk assessment. So I think one of the primary risks assessment is only being by yourself, right? Looking at your capacity, not just in the department, but your capacity as an individual. The director is focused on so many things. As a singular deputy, I was focused on all the things she was focused on. And so having a colleague that I could turn to me was one of the most important aspects of how we responded to the fires. Because as Terry mentioned, wildfires in Hawaii, and we've had brush fires, that maybe burned, a few acres, but that was it. Never did we have the culmination of a hurricane passing to the south of us, a fire getting ignited, hurricane force winds, Hurricane Dora, just decimating Lahaina, which was the historical capital of Hawaii under the Kingdom of Hawaii. And so that was something that was never in our playbook. So let me just go to risk assessment really fast, and then I'll talk more about our experiences in Hawaii. So always write natural hazards. What I've learned is as you do your risk assessments, think of the unthinkable. Because as I mentioned, right, Hawaii, we would have never thought that wildfires would be an issue that we had to deal with. California, Oregon, yes. And I guess we should add Washington to that, right? And Colorado and wherever else, Louisiana. But in Hawaii, never. We were always focused, and all of our tabletop exercises and what have you, always dealt with hurricanes, and that was it. And on occasion, a flood tabletop might have come through. But in addition to thinking about what kind of natural hazards you might encounter, you also need to think about the man-made disasters. So infrastructure that collapses, hearing about the, the Francis Scott Key Bridge in Baltimore, right? And how that impacted the ability for goods and services to get in. Thinking about my specialty is national security studies and terrorism. So thinking about terrorism, civil unrest, things of that sort. Then also thinking about cyber security and those other issues that are emerging as threats. Always look at the vulnerability analysis and then look at your impact analysis, especially for human services. What are the impacts of possible, disasters, especially when thinking about all the services that human services provides, right? Whether it's food benefits, economic benefits, SNAP, grants and aid, TANF, then looking at the services we provide to children welfare services or adult protective services, disability vocational rehab services. So it's a wide variety. And in Hawaii, our human services also covers Medicaid. So that's also one of the issues that we have to look at as well. So going back to just talking about lessons learned, one thing I also want to stress is the great gratitude that we have to ACF. I believe Natalie reached out to us on day 3 of the fires, to say, and this to me was the most important thing, what do you need and how can we help? There are other federal agencies that sometimes come in and say, this is what you need to do. And just having that difference of what do you need and how can we help compared to this is what you need to do opens up a space for us to have a dialogue, a conversation, look at what our capabilities are and work, move forward. Sometimes when it's, this is what you need to do, the armor goes up, right? A little bit of a defense mechanism clicks in. But so then going back to experiences, one thing I really need again to stress is the ability to reach out to a colleague and say, I don't have to do this on my own. We will do this together. And that really helped us, especially as we were moving forward. Trista, Deputy Director Spear, took over like the disaster case management program and a rental assistance program. I did more of the deep housing. I never thought I would be a developer, but am responsible for creating a 57-acre site with 450 modular homes. So just knowing that we could share the burden, but also constantly be in contact with each other and collaboratively looking, I would ask her some issues that to me I wasn't sure about. She could ask me the same. And so really having that ability to connect with someone that can help with the burden, I think is super important. And then reaching out to our colleagues who have the full experience. After the safe harbor period for non-congregate sheltering, 45 days, we were told that pre-disaster homeless could not be housed in the non-congregate shelter program. Ed, and I believe probably RJ, with his experiences with Paradise and what have you, immediately told us, hey, here's an option, field shelters. These massive military grade field shelters that can house 20 people. And I think we put up about 15 of those, and if it wasn't for the support from Oregon and California, in 2 weeks, I had no idea what we were going to do. And so just having that ability to reach out to colleagues for us on the continent who had that experience.
Thank you so much. Joseph, the panelists, thank you. So we're talking about the dimensions of disaster, and we are looking through the experiences of the panelists to kind of understand the 4D, 5D nature of this. And particularly, we have mentioned different federal agencies. We've mentioned NGOs. We've mentioned different funding sources. You have mentioned different federal programs being administered by different agencies outside of yourself. You've mentioned data sharing. You've mentioned a lot of dimensions. And I think it's important for us to recognize that every state is set up differently, right? In Louisiana, you mentioned Medicaid, that's our sister agency. The Social Services Block Grant is in one agency being spent by several. The Community Services Block Grant is in one agency. And in Louisiana, anything coming through FEMA or the Stafford Act is going to be going through the Governor's Office of Homeland Security Emergency Preparedness. And I would say our work with sister agencies that work with disasters is ongoing. Is that a good word? Like we're continuing to build relationships. And so I'd like the panelists who've been working well together, and I appreciate the calls being made. And on fires, we started making some phone calls, but my experience really came, for example, in 2020. Where were you September 2020? We were all probably at home working. It's pandemic. Sometimes we forget about the pandemic. I don't know how. But at that time, Louisiana, who's used to housing people who are evacuated, normally above I-10. They're leaving from the New Orleans area and they're being placed throughout the state. Well, we were being hit multiple times on the west side of the southern border. And for the first time ever, we had 18,000 people being sheltered in New Orleans, which is where you want to get people out of. Oh, and it was the pandemic, so they had to be sheltered in hotels, which luckily were not being used because it was the pandemic, but there's nothing in the plan for that. So how important is it to be nimble in order to be great for people? And so I think this is when we go to our federal partners and ask them to be nimble with us, right? And be able to work together with the other federal agencies. So to continue with this experience, I would like the panelists to ask another panelist a question. This way, we will kind of weave their working together and understanding their perspectives and experiences. So I'll start with you.
Okay, I'll ask Ed. For those, we've talked about disaster case management, and Trista kind of mentioned that during the Maui wildfires, both Ed and I got on a call, several calls with Hawaii to discuss disaster case management, because California and Oregon, we do it completely different. I actually spent a good amount of time with Ed going down to look at Oregon, and he did the same around 2021 to compare our programs. So with that, I'll say, to Ed, what are some of your biggest challenges in running the disaster case management program?
It's a great question. Yeah, I'll be brief. I think that looking back now, and we are about 3 weeks away from our 4-year anniversary for the fires we discussed. And we didn't have a program. There was one really person that did the work I do before September 2020. So we had to build it all after the incident, and emergency managers don't like doing that at all. We find ourselves doing it all the time, though. The federal disaster case management program has a specific focus, and I think because it's grounded in the Stafford Act, it is not really geared to support survivors through the long haul. And our governor at the time, Governor Brown, gave us a really, really big mission to house, shelter, support people, all people displaced by the fire until they transition into more permanent forms of housing. And of course, in the federal policy world, that's HUD. But when we really got the disaster case management program up and running, we realized the federal timeline to get the federal grant wasn't going to be in a timely fashion. So our director gave me the direction to establish a state program, which operated. The federal program came in, the federal program left. And what FEMA's expectation is that that grant ran out, that we would really end the case management program. Lo and behold, year passes, new governor. We're still waiting for the community development block grant for disaster recovery with the long-term recovery resources. And new governor comes in and says, how's the case management program going? And we had to operate our case management program really to comport to the FEMA requirement, which doesn't get people through long-term recovery. So my big experience is we need, as states, to take care of our residents, regardless of federal frameworks. And I firmly believe that that means having a case management program. I mean, as human service agencies, it should be our core competency. We should be able to do that as a matter of course. And also to do it in periods that don't include a federal declaration. You know, Oregon doesn't get a lot of federal declarations, frankly. So my takeaway is develop it. And really what we're doing is taking that workforce and focusing them on community organizing and development and resilience space to really increase Oregon's ability to take care of its people every day. And then as necessary, they can do case management when a disaster occurs.
So I want to follow up with you on that before you ask a question. And that is the layering of not only the disaster case management program, but at the same time, you're also thinking about other programs. And I appreciate it, for example, Commissioner Gray, who talked about certain programs needing some flexibilities because are you using another workforce for these new programs? Sometimes are using your own in a different way. Do you want to hit on that?
I absolutely. I think that we need more flexibility to deploy our programs that really are in the business of supporting Oregonians every day in order to do a better job of supporting Oregonians in that crisis moment, right? And so we have found new ways to partner within our programs, but we are often bound by the federal requirements that I can't deploy that workforce. We have a program now in Oregon where I can recruit Oregon Department of Human Services employees, and we call them mass care response team members, and I can activate them and mobilize them, and they go out and they assist, but they're away from their day job. And the case management workload ratios don't support it, right? And I think that is a key area of flexibility I'd love to explore.
Thank you. And I appreciate it, Commissioner Gray, bringing that up. Do you have a question for our panelist?
I do. I'm going to ask Trista, what has she learned about the intersection of the FEMA Individual Assistance Program and your transitional housing programs?
That there's a lot of intersection, right? There's a lot of intersection. Jonah keeps saying, right, this is, when you look at disaster response, it's a Venn diagram. It's just how many different Venn overlaps, right, are there? And, to Joe's point of Natalie and her team being phenomenal in their immediate response and what do you need and how can we help to open up that space? And I would say that Ed and his team and JR did the same for us to be able to talk collaboratively through that, which leads to what have I learned about it? It was a very quick, for me, onboarding process, right? Uploading process. I said, I wish I was the Matrix and could just plug some of this knowledge into my head on day 6 of the job. But there's a lot of overlap because FEMA with the Stafford Act, of course, they have an amazing mission, right? And a lot of it is it's a monumental task, right? Of how do you provide so much help within the confines of the Stafford Act to as many people as possible, but especially in Hawaii, where we have such a high number of COFA residents. We have such a diverse population full of immigrants and people of all backgrounds. Our governor led with equity. It didn't matter where you called home. If on the day of the fires, you called somewhere within the burn zone your home, whether that was the banyan tree, whether that was the 4-bedroom, 3-bathroom house, or anywhere in between, you were to receive the same level of care, services, housing stability, and the like. And what has struck me is that everyone is trying to move in the same direction, whether it's FEMA with their interim housing programs or the state, which DHS has led many of those efforts with the build site Kalai'ula that has broken ground and the first residents have moved in, or the rental assistance program that we developed to leverage the short-term rental market in Hawaii in a way that's never been managed before. I think that there's really something there with innovation to try and, move forward together so that at the next disaster, how can we be even faster with our response, faster with our aid, and faster with the stability that we can offer these survivors? these families, these children. And what we have all learned working in human services is, right? Raise your hand if you've heard of ACEs, right? Everyone who works in human services has heard of ACEs. How many ACEs do you think these children and young adults, because remember, when does our brain stop developing? Yep, sometimes even later, right? So how many ACEs come out of a disaster? Not to mention those that have already been experienced by many of our families who are already disproportionately impacted by crises and response and inner workings. And so I would say, I'm trying to answer the question directly, but what I've learned is there's so much overlap, but it operates in such silos. My recommendation and hope is that we can come together, that we can move forward together, that ACF can answer this call for help and assistance so that we can have more flexible, nimble funding to build these frameworks so that together we can respond faster, so that for the next disaster, for the next responder, they have a different day 1 or day 6, right? And that the survivors, we would never have been able to submit our application for DCMP within less than 2 weeks from when we actually even learned it was a thing, had it not been for reaching back to the support of California and Oregon. And how did you do it, JR? How did you do it, Ed? And then for us to analyze, okay, these 7 aspects will work for Hawaii, for our jurisdiction, and Maui within that community, because that's different from Southern Oregon. That's different from Northern California. And then these won't work for us. But then how do we pivot, right? Talking with them, talking with Natalie, talking with her team. How do we turn it into something that is the right response for our community? We could not have been that fast had it not been for that collaboration. So let's reduce these things to writing. Let's put them into playbooks so that we can share them. And there's a knowledge of what can ACF or Human Services offer, what is FEMA's playbook, what is their plans, so that you can very nimbly, very effectively, very quickly and flexibly adjust your department's response for your community and their needs immediately.
Thank you, Tristan. Before you ask a question, I wanted to kind of pivot from this question about IA. And I want to make sure that all of the federal people that work with us on our regular Blue Sky programs actually know what IA is. And so one of the things that we're dealing with in our Forward Together is the number of people that are new to our programs. So it's one thing to learn the program that you were hired for. It's a whole different thing to learn about the ICS structure and what happens when we don't have a Blue Sky Day and now we have an incident. That's turnover is happening in the federal. It's happening at the state, it's happening at the local, and it's happening with our elected officials. Right. And so part of what you're doing is that California said, hey, we'll put some money up front for our program. Well, that probably took some legislative action. And if it didn't, it took someone in a policy and administrative manner to understand the need. Well, it's not easy to understand the need, particularly if you haven't worked in it. Right? It's easier to think, why didn't they just do this when you don't understand the complexities, right, of the different funding sources and when you can use each one. So I think, when I think about individual assistance, I think about DSNAP, which is not an ACF program, but also goes to the basic needs of the children, families, the communities, the elderly in a disaster, who have lost their home, who have lost the resources. And Louisiana experienced DSNAP at its highest ever point, even greater than Katrina in 2020. And then again in 2021. And that was based on, rapid fire. I think we had 5 hurricanes hit us that season, and we were in pandemic, and it had to be done virtually. And so we'd never done that before, but the services that we had for driver's licensing had just gone electronic. So it helped us, but it required our IT department that's in another state agency to lean in, and we had to then pull more people. And so we continue to be in this space where in order to help people holistically, it takes a lot of people to know what individual assistance is and what our program's scalability is during which events. So we have to kind of keep training. And I think this gives us, some things that we have to continue to work on together. And there's a lot of grace that needs to go into that. So Trista, do you have a question?
I do, but Terry, get out of my head. Because so my question to Deputy Director Campos is, while we're on this theme of, forward together and learning, hindsight's 2020. What do you wish we had known on August 8th that we now know that would have expedited our response? And specifically, because and this is where Terry's clearly in my head, one thing that we haven't touched on is our DSTAP response and our ability to quickly respond to that, which you led.
Okay, thanks. So I'm going to kind of play off of Ed's question to Trista about intersections, because I have never seen so many traffic lights at these intersections in my life. It seems that as things intersect with each other, you either get a yellow light or a red light that comes up. And hindsight is, I would like to have destroyed all of those traffic lights. And this is something that Natalie told us in week 3 of the fire, or from the fire. She told me, and I think yourself, I think we were in the meeting together, and Natalie's looking at me like, what are you going to say? But she told me, this is a human services disaster. Because one of the things that I was grappling with were all these people who were saying, why are you guys involved? Especially when it comes to the housing purpose or the housing initiative. We have some other agencies that specialize in that. And it's, why is DHS involved in housing? Well, DHS is the lead agency for ESF 6, which is shelter and feeding. And it's a duh, right? Of course, this is still sheltering. And so when Natalie told me that this is a human services disaster, that sort of gave me a green light to basically say, this is what we're doing. No one else is stepping up. We're going to go forward and do it. A lot of lessons learned as we went through that. Like I said, I never thought I would become a developer. That might be my second career, since I made 30 years of service on June 30th. So who knows what my future holds. But yeah, so that's one of the big things for me, is all the red lights that you get thrown up, and it's like, let us do what we need to do. I'm a big believer in the philosophy of ask for, what is it? Ask for permission. No, don't ask for permission, ask for forgiveness, or one of those things, right? Just do it. And if you need to ask for forgiveness later, at least it was done, or something was done. So our DSNAP program, one of the big issues, and I think Deputy Director Spear talked about, was the multicultural nature of Hawaii. We have about 16 primary languages. So always knowing always remembering the necessity for language access. This was something. I speak passable Spanish, I think. I can argue with my mother-in-law. So my wife says that, my wife is from Spain. So she says that, my Spanish is more than passable if I can argue with my mother-in-law. But so I went to the DSNAP program. It was a week. We serviced over 3,800 individuals. I did the interview because they don't consider the deputy director a merit staff person. So I couldn't determine the eligibility, but I could do the interview. And I was primarily interviewing people in Spanish. because there is a large Hispanic population in Hawaii. So that to me is the kind of main hindsight, is always remembering the necessity for language access.
I appreciate you saying that. In this conversation about helping one another, in 2020, we were not able to do what we did without the help of Oklahoma and Texas. And Texas brought to us, and because it was virtual, they were able to help us by staying where they were and getting on our platform. And thankful to several things that had happened on the blue sky side of SNAP allowed us to be ready for that. And so there was a lot of things, the stars aligned for us to do it. But if Texas had not come forward, Louisiana would not have been able to serve well those who had our increasing numbers of Spanish speakers in Louisiana. And then Oklahoma just came forward and said, whatever you need. And so they took a lot of calls. And so I did have somebody send me the number because I forgot to get it before I got here. But from the March flood in 2016 to Hurricane Ida in 2021, during DSNAP, we served 1.1 million people and issued 283 million plus of DSNAP benefits in that time. And it requires even the local emergency managers to ask for it once IA is eligible in their area. And so there's a lot that goes into that. And I appreciate the complexities are growing in each of our states to understand how do we serve people well, because in the end, it is about the people. And as each of you have talked about emergency managers, and that you've been brought on, and then you might be in an office that we didn't have before. Louisiana, post-Katrina, we set up an emergency, an ESF 6 office. But as you can imagine, the focus of it is really mass care. It's not really human services. And so a lot of what we worked with HHS ACF OHSEPR on is the federal government made a change in 2016. That was that first change of how are we going to recover? We're going to recover with these different I think it was 6 different ways. And DCFS was responsible with LDH to do social services. And so we were leaning in on this day-to-day every month from 2016 after we learned the governor signed, we will set up our recovery the way that the federal government has set up their recovery. And we got trained in July of 2016, and the Great Flood happened in August. And because the federal government was leading and our governor said we will follow and we'll do the same, we were ready. And so I see Garcia, who's here from Louisiana Department of Health. She can attest every month we were working together to figure out how to help. But it wasn't just us, it was a broad group of people that got us through the flood and then got us prepared for the rest. So there's this continual improvement that is available to us, but there's also continued changes to the people that we're helping, right?
So I just want to give a shout out to Oklahoma as well.
Yes.
Justin Brown. You know, I'm not sure if he was still the director at that point, or
He
the
was.
secretary. Yeah. And for the fires in August of 2023. But he immediately texted me the next day and said, "Hey, anything you need, just let me know." And then when we were doing our DSNAP, you know, gearing up for that, he reached out, or I reached out to him, and then he gave us his experiences with DSNAP. So just a shout out to Oklahoma and Justin.
Yep. Did you have a question? Go ahead, Tristan.
Oh, if I could just add, right, to your point of being nimble and what Deputy Director Campos was sharing, right, with our DSNAP program, it was originally envisioned, I believe, to go about a week. But looking at the response, looking at the language barriers, language access, we were finding that, you know, survivors, you know, trying to find out what do you need. Oh, I just need $100, $200 in groceries. Wait a minute, you've got a family of 6. Did you have a freezer in your garage? Did you have another refrigerator in your garage, right? In prosecution in the courtroom, we say garbage in, garbage out, right? So
Right.
if you don't ask the right question,
That's
you may
right.
not actually get the answer. So it was understanding from that experience working in human services, working with child welfare, working in case management, unrelated to disasters previously, of understanding the importance of reframing the question. And I remember Joe sharing the story of there was one family he talked through, and it was they had 2 freezers, they had 2 refrigerators. Well, how many times did it take you to go to Costco to fill those total? Well, maybe about 6. And about how much time or how much money did you spend on each Costco run? $500 to $800. Okay, so actually we're looking at, I can't do math, sorry.
Right.
That's why I went into law, but right, like, okay, you're looking at 3 to 6 grand, not a couple hundred, right? And so understanding being flexible, and then our amazing team, like Ed said, right? We're pulling on existing human services staff. We already have, I don't know about you all, but 20 to 40% vacancy rates. Everybody's bandwidth, but the team willing to say, we'll deploy for another week if that's what's needed. So we did about 2 weeks and 8,000 people, recognizing that need for that expansion. And I would be remiss to Ed's question and a lot of what you were saying, Terry, with IA and their intersection with housing. We understand in human services the importance of stability with housing, right? How often in our child welfare cases is that one of the first allegations in a petition, right? Instability, financial instability, lifestyle instability, housing instability. So the importance of the intersection with FEMA and their IA program and their interim housing, in my humble opinion, this is just me, Trista Spear, standing before you today, is the importance of all survivors having access to stable shelter and interim housing for the long term. Because without that, we are going to see the rest of our human services divisions become inundated. And we are going to see an uptick in mental health, in ACEs, and mental health and physical health long-term down the line. And so that's where I would see that intersection and the need to break down those silos and work collaboratively within different agencies and their guardrails and their missions to ensure equitable access to stability for all.
Well, I appreciate that equity because listen, anybody who's been around FEMA for a while understands that the way that the rules in the Stafford Act are created is a person who owns a home is going to get different resources than someone who is renting. And if we start off there, understanding that those who are most stable prior are going to get more help from the Stafford Act than someone who is a renter, you understand how important it is for us to pull together all our regular, what I call the regular human services programs to bear. And I think it's incumbent upon the state agencies to understand that you need to take a new look at your new normal because it takes a long time to recover. Right? Recovery is not immediate. And the thought about being prepared, being able to respond and being able to recover, those are overlapping Venn diagrams. And not all the programs can do everything, but Director Flack talked about TANF, for example. And one example that we were able to use post one of the events as the Lake Charles, Calcasieu Parish, Louisiana was just hit like multiple times. So we had surplus because Louisiana uses all of its TANF money. Okay. Right, Ann? Okay. We were able to, give a $250,000 grant to the local NGO there who served most people for them to help bridge rental assistance for 4 months and other things. But then it also helped us to understand that some of the NGOs didn't really understand the rest of the human services array that they should also be bringing to bear. Let's talk about how can we get childcare back up. Let's talk about how that is both helpful for the parent, but also for the economic stability of the entire county, right? The state. To get businesses back up, you need employees, and that is childcare. And then we would employ up to 1/3 of our staff to the events that were happening on emergencies. But we were holding back as much as possible those that were doing child welfare and their regular basis, understanding that they need stability first and foremost because of the ACEs and because of all the things that Commissioner Jones-Gaston brought up. And so there are so many things happening at one time. We have to be able to look at all these grants and understand them. And I think that there's too many of us. I think we should be constantly learning about another grant, the other state agency. How are they doing things? And that is what will happen if we're continually meeting together every month.
If I could just make one comment, I know we're at time.
Absolutely.
I'd be remiss if I didn't say this though. I said my job is to support 9 tribes in 36 counties, and I see Shelby over there. I saw a map in the New York Times that pointed out the places of Butte County that have not actually burned yet. You know, this is dramatic stuff.
Yes.
It's its own professional track. There's very specific knowledge here. I would ask that HHS consider, how do you support capacity at the state and local level for human services emergency management, the same way that FEMA does for emergency management through the Emergency Management Performance Grant, and that Health and Human Services supports healthcare preparedness through ASPR, because we can't continue to try and learn these lessons. I mean, I met Trista. I was in Lahaina. She's trying to run down a Starlink so she can get people registered in Airbnbs. Joe was doing language interviews. And these are the 2 directors of Hawaii Department of Human Services. You know, we have offices that are general funded. And if HHS could build on the framework and provide a capacity that could be depended on, I just think we shorten that learning curve.
So I want you to go ahead and speak, but I want to underscore this. All of the emergency managers that work at DCFS in Louisiana are also state funded because there's no federal resource that will allow for that to be funded. So I think you got something there.
I was gonna just quickly talk, and it kind of took my my plug there for Shelby, but I'm gonna get there here. Is we've talked a lot about cross collaboration between Hawaii, Oregon, and California, and the calls that we've had about it. But honestly, Shelby Boston in the room here is the mass care and shelter at the county level for Butte County in California. And for those of you that aren't aware, Butte County is the location of the Paradise Fire. And Shelby was and is still the mass care person. And for us, while it's important for us to collaborate internally on state to state, Shelby and her team is the one we're actually boots on the ground day one, hour one. So while my job is to support her job is to be there right away. And so one of the things that we've done is we've spent a lot of time, or I started this job in March of 2020. And if you've heard of anything from this group, it sounds like we all start right around a disaster. So be careful on your start dates. But I encourage you to reach out to Shelby, because honestly, I can only imagine what it was like going through the campfire, the stress, all of the things that went into responding to and being there for people during California's most deadliest wildfire in history. But at the same time, people like me, need to take advantage of people like Shelby that have gone through these experiences so that we can learn how to better do our jobs in the future. And that's very important. And again, for those of you that are in the room and would love to pick Shelby's brain, she's right over there. And for those of you on the line, her phone number is
I've got it.
Yeah. I left my phone at the table, so. But I wanted to plug that it's really important that while we do state to state, it's really important to understand county needs and your local jurisdiction needs as well.
Thank you for saying that. It kind of goes into how we're talking about this from the human services and the ACF standpoint, but all of us start our work under FEMA guidance. Like all of this starts when there's something that happens and your emergency office is working and you're working under an ICS structure with them. And then you go from there. And it's so important for all of us to really kind of get there. in recovery side, we had to kind of go to, we would call them RSF1. I can't remember. It's like the community building recovery, and say, you know, that most of the emergency managers in the parishes, we call them parishes, y'all call them county, we're right in Louisiana. But anyway, they are thinking about getting the roads clear and the hospitals back up. They're not they're not created in their, you know, they haven't been trained to think about human services like us. Do you have any stories that could help us understand how important it is to keep collaborating more with the locals? You gave us one. What happens if it doesn't work well? You guys have any experience there?
Well, I mean, I started out as a county emergency manager, and human services recovery was something I could never solve for. You know, I think a lot of the local public health folks, they view it through a public health lens. And I think we need to think about a broader definition of healthy communities. The emergency managers really struggle. You know, we got some wonderful NGO partners, but at the end of the day, the folks that are disproportionately impacted are receiving support and services from us already. And I think how we can develop local capacity and whole of community capacity is so important. It goes back to how do we build the preparedness we would like to have had the day before our fires.
So just coming from the Hawaii perspective, as a colonized state, you know, there's a lot of apprehension when the continental hope comes in, right? Other people call it great blank hope, right? But I'll just call it the continental hope. Especially when they come in with the perspective of this is what you need to do. Yeah, I already talked about ACFs coming in with what do you need and how can we help, which was so much different than that this is what you need. So a lot of the local communities, the community-based organizations are very wary of the continental hope that comes in, and they have stressed the need to build local capacity. But they were very apprehensive about getting involved with directions coming from the continent. So that's one big issue. You know, we have a fantastic staff member, Malia Tomdinek, who took over ESF 6 functions for us because she knew how busy we were doing everything else. And they just ended their ESF 6 calls, I think, in June. But, you know, that's working with American Red Cross, Salvation Army, VOAD, all of these other community-based organizations that are part of ESF 6. You know, so it's also good to have that interaction where I think they were meeting in the beginning almost daily and then weekly. And I think towards the end, maybe they did 1 month and then they closed up.
Yeah,
So,
that's where we would be like a couple of times a day in an incident, then once a day, and then moving from ESF to recovery support function monthly. Trista?
Just really quick, I mean, Maui County, we have to give recognition. Maui County has been phenomenal to work with. The mayor's office, his whole team, and like Joe said, the local organizations. But I would say, so I don't have an example of when it didn't work because we very quickly leaned into wanting to have this positive relationship and collaboration. And I really would be remiss if I didn't recognize Joe, Deputy Director Campos, for assisting in that, right? Brand new, on the job, been there for less than a week. As he said, there's this apprehension from the Continental Hope, but recognizing the importance of those relationships and continuing to have stubborn optimism to push, to schedule meetings, to bridge, you know, bridge relationships, bridge communication lines. And I don't have a negative experience where it didn't go well, but one where you know you can continue to build on that relationship, foster that collaboration and camaraderie, and, you know, Joe's leadership with that and assistance with helping not only me as a new colleague, but everyone's response, whether they were a human services person, a federal person, a different state stakeholder, was just incredibly beneficial to continuing to efficiently and expeditiously bridge those gaps.
So then I'll just return the compliment because when Trista asked, what, I didn't even answer that part of the question, right? Which was something to the effect of, what would you have wanted to know on August 8th? Director Betts and I, when Trista came on August 2nd, we figured, we have a lot of time to onboard her. Onboarding, I don't think occurred until April, right? It's still really happening, and that's what I wish we would have done immediately, was onboarding the new deputy, because, and so this is where the compliment comes in. She jumped in feet first into the deep end and found a way to float and swim, because she was just an amazing partner throughout this whole process. So
Thank you for sharing. And this, I guess, showing or illustration of how much it takes to rely on each other and to give kudos along the way. There's a lot of grace involved in emergency management and helping families. So I think we have a question on the floor.
Yes. Is this yep, sounds like this mic is on. So we're beginning the Q&A portion of this particular panel, and we have a question that's come in from the universe, the internet. This is a question for any of the panelists on the stage. How do each of your agencies engage people with disabilities and other disability experts when delivering post-disaster housing, FEMA, IA, and disaster case management programs? Another attendee added that Oregon and California have strong access and functional needs plans, but this question is really to all panelists.
Thank you so much. Anybody want to get started?
And anyone has a question in the room, please come up to this mic. Thank you.
okay, so I'll start off. One of the, I think, beneficial things about people who experience disability, the community, is they're strong advocates for their needs. So immediately when we did the field shelter for the pre-disaster homeless, we had to ensure that we had disability access. All of the homes that we're putting up, have at least 10% disability ADA accommodation. I think the law requires 5%, but we're also looking at doing it as a as needed basis too. So if we need to request more units that are ADA friendly, we'll definitely do that. But we have at least 10% coming in. The one thing that I think we always, at least I forget about, which I'll call out, is the sound impaired. I don't even know what the right word is, hearing impaired. You think about those who are disabled in wheelchairs or things of that sort, but I always forget that, there was also hearing impairments, so that's something that I always have to check myself on. But we do definitely have that focus. And part of it is because one of our divisions within DHS Hawaii is the Division of Vocational Rehab. So it's nice that we're always reminded of that need.
Thank you.
Yeah, I'll add in California, and for our normal coordination during disasters and before, we work with the California Governor's Office of Emergency Services, Office of Access and Functional Needs, to make sure that we are addressing those types of issues. But at the same time, in this last, I want to say 1 to 2 years, we've created what's called the Priorities Population Task Force. And so during disasters or right before a disaster, there's about, and I want to get it right, how many different departments under, and I believe it's 12 different departments and 5 offices will jump on a call every morning, nights, weekends, and holidays to make sure that we're discussing how we can best address the needs of people that will be coming to shelters that maybe can't make it to shelters. We've partnered with Uber during disasters to make sure that people can make it to shelters, that you can use the different Uber accessible lifts or to get to shelters to and from their house. So we do bring people together that have the expertise, and then also to listen and find out what we could be missing. Because while my job is to help the counties with coordinating mass care and shelter, there may be so many other parts before people get to that shelter that we may not even be aware of. So if we can find out that there's going to be a large influx of population that we can help before they get there, instead of saying that they're at the shelter, this is what they need, we can say, hey, we know this population is going to need this or these services. Let's try and get it there before they arrive.
I'll just share that one way we meet those needs is through our programs. In particular, I'm very concerned that we assist our counties to understand who may need to be evacuated and to get that accomplished in a timely fashion. So we work whenever there's an evacuation level, and through our programs, calling out to folks that are in the caseload, right? So we work with the people that work with those folks every day. We really struggle though, particularly in rural Oregon, a lot of places that are shelters aren't ADA accessible. So we send out resources for hygiene, for example, shower trailers, things like that. There's a lot of practical lessons that we've taken from California in that regard. One of our biggest challenges is frankly transportation, is being able to help people get to the assistance that they need. Given those limitations, we put a real priority on helping people being safe in their own homes. We do that in part through programmatics by extending eligible hours for home care, right? So people have the assistance they need, and that the home care workers can also transport people to shelters when they need to. But I'd be less than honest if I said we have this all figured out. I think we will always have gaps, and we need to see those and own those and make sure that we are leading with equity when we do our plans with the folks that are going to be affected.
And I think just quickly, I know we're running low on time, but quickly to Ed's point with the gaps, I think part of the importance, especially to the issue of disability access, is what are the current programs that are funded by the existing grants? What are they and what are they not? So the disaster case management program, we're living it right now, is I'm constantly getting emails. Here's someone with this functional need. Here, they need X, give it to them. Unfortunately, that's not what the disaster case management program can do within the purview and the auspices of the funding from FEMA. It is a case management program that provides support services. They're your quarterback to recovery, but they can only connect that survivor with the available resources in the community. And so I would say the gap is, if we understand as jurisdictions, as our federal family recognizes this is a need, let's plan in advance, let's get some funding, let's have some of those resources funded so that when there is a disaster, the case manager has somewhere to turn to say, here is an ADA compliant interim housing solution. Here is ADA compliant transportation solution. But we right now are facing cases, we have exhausted every possible community resource, and the disaster case manager is going above and beyond, and every day, hours a day, trying to work with the family, but there isn't an answer.
That's a very good point. And I think to have a catalog of all services available that someone might be able to apply to sort of a regular program and get services, or sometimes if people don't qualify for certain things, in the disaster, but they have become eligible where they thought that they were not for another program. So even the DCM caseworkers have to understand the blue sky services, right, in order to really help someone. In Louisiana, we did start using 211. We got a cooperative endeavor agreement approved with the agencies that run 211, and then started plussing up the information that we had available in 211 so that anybody could call 211. But then we also got weighted blankets at the shelters, and we got certain things that certain individuals would need. In Louisiana, the governor had an office that would meet with us every day in an incident that were talking about the different communities or people with particular services that were needed and how we're going to take care of those. I think pulling in those advocates are important in the incident. We have another question.
Hi, I'm from Alyssa Wheeler from the Office on Trafficking in Persons here at ACF. And my question is, I think primarily for Ed and Terry, because Ed, you mentioned the HHS's response to the healthcare sector and support for the healthcare sector. And then Terry, you mentioned back in 2016, the federal response and how that was helpful. And so my question is from the state perspective. I don't know if you're familiar with the directive, the presidential memo from April that came out, Presidential Memo 22, that requires each critical infrastructure sector to do a risk assessment. At OTEP, one of our priorities has been getting human services integrated, making sure we're represented in those risk assessments and strategies, especially for the healthcare and public health sector. And so from the state perspective, how can we better integrate human services into that process, make sure that you all are involved and represented? Anyone can be a part of that critical infrastructure partnership for the healthcare and public health sector, but human services is very underrepresented. And so if you could speak to that a little bit.
I think it's a wonderful question. And we talk a lot about intersections, and the intersection of critical infrastructure and vulnerabilities and failures to people. We bring the individual perspective to those conversations. We just came off 7 weeks of activation where we saw public safety power shutoffs, we saw communication systems down, we saw interruptions to roads, systems like that. And so what we've tried to do is really focus in on describing what FEMA would describe as the context of an interruption. And I think the new FEMA doctrine and lifelines, which isn't all that new, came out of the experience of Puerto Rico in 2017. We really are utilizing that doctrine to think about what kind of emergency stabilization measures can we bring to the table that are person-centered, that will reduce the impact of lifeline failures on the community. One of the things that we have found is there's a lot of tools in the current Medicaid waivers that Oregon has to provide life-sustaining equipment to people, right? So we think about how do we take information that we have within our programs for people that are dependent on electrically powered devices or other kinds of things that make them safe in their homes, and how do we assist them to stay safe in their home while someone else is working on the infrastructure to get it working again. And I think that human services has not been at that table enough, right? And I think that part of what the framework can do is elevate the voices of the people that have human perspective to those conversations.
Thank you so much, Ed. And as we get to a close, I want to say that in Louisiana, when I was there, if anybody called us about anybody going to any meeting to talk about people, we were going to be there. And I think someone mentioned being in a room and somebody going like, why are you here, right? I'd rather have that question asked of me than why weren't you there in the room when it happened, right? And so I think now more than ever, we're finding that more of us are understanding the war that is poverty, the war on families that are in poverty. And then we're also recognizing the vulnerability of these different groups, especially those in deep poverty, those who are in care, and how vulnerable they are to human trafficking. And so in Louisiana, there's quite a bit of legislation and education happening about trafficking to make sure that those things are being picked up in all of the work that we're doing. But suffice it to say, as we look at these perspectives and experiences, it seems like what we're saying is intersections are important spaces. We want to take down the stoplights. And I feel like what Natalie and Byron and all have done here in our Forward Together spaces have been what we hate, is when the lights are not working anymore. And then you have somebody with a stop sign in the middle and they determine who gets to go and who's not. And so sometimes when the stoplight's down, you might get to go when you otherwise would not have been able to go. And so what I appreciate what's happening here in this convening is that we are determining, where are they, those spaces that we can work together, and how can we hear from one another more and more to get the right answers for the children and families of these United States so we can do better and better towards families. I want to ask you to please thank our panelists for the time that they spent preparing, for the experience that they have. It has been wonderful to be with you guys. Thank y'all so much. Thank you.
Right, let's hear one more time for our panelists, everybody. At this time, we would like to present a quick video just to share out a little bit more about OHSEPR and their work.
The people in communities that have the hardest time recovering from a disaster are often vulnerable or have limited access to resources. At the Administration for Children and Families, or ACF, we believe human services are the essential link to supporting people before, during, and after a disaster. The Emergency Management Program for ACF, the Office of Human Services Emergency Preparedness and Response, or OHSEPR, bridges the communities of emergency management and human services. OHSEPR's mission is to lead, strengthen, and unify human services to prepare, respond, and recover from emergencies and crises. We are committed to advancing equity in disaster response, so the most vulnerable receive the right services at the right time. Our holistic, people-centric approach puts individuals, families, and communities at the heart of emergency response. This approach recognizes that disasters impact people, and responses should be tailored to meet their needs. That's why we believe it's important to invest in community engagement activities, educate the public, and coordinate with service providers before an emergency to lay the groundwork for effective response and recovery. Every day, ACF programs provide a wide variety of human and social services in communities across the nation. ACF programs help individuals become economically stable, support parents and caregivers, develop communities, and provide pathways to transition from crisis to self-sufficiency. Some services include early childhood development and education, child welfare, foster care, direct financial assistance, housing, and case management. ACF also provides preventative and supportive programs for family violence prevention, human trafficking prevention, and refugee assistance. OHSEPR is focused on helping communities, service providers, and households get back on their feet, especially after a disaster or crisis. That's why we collaborate closely with emergency management and social services agencies, healthcare providers, and community organizations to provide services that are responsive to disaster survivors' needs. Through these activities, OHSEPR is upholding its vision of building a robust national disaster response infrastructure that focuses on the human services needs of individuals, families, and communities.
Logo, Administration for Children and Families Office of Human Services Emergency
All right,
Preparedness and
folks, at this
Response.
time, we will
Two
be taking
surveyors standing in
a
front of
quick
housing.
lunch break. We will begin promptly at 1:10 p.m. So please return at that time, or at least 5 minutes prior, to continue the great work and the great conversations here. So thank you, and we'll see you shortly.
Which have been destroyed by a natural
Test 1, 2. Check 1, 2. Check, check. Check, check. Check 1, 2. Check, check. Check 1, 2. Check 1, 2. Check 1, 2, 2, 2. Check, check 1, 2.
Mic test, 1, 2. Mic test, 1, 2. Yeah. Testing, testing. All right.
All right, folks, welcome back. I hope everyone had a great lunch break. We're very excited to get the next session going. We have Achieving Equitable Outcomes in Disaster Human Services. And this panel will be moderated by Mr. Dia Harris. So please give Mr. Dia Harris and this panel a round of applause. Appreciate it.
Hello, everyone. My name is Dia Harris. I'm actually the Chief Equity Officer for the Administration for Children and Families. It is my pleasure to welcome you today to today's session, Achieving Equitable Outcomes in Disaster Human Services, a vital component of our conference today, which is titled Forward Together, Shaping the Future of Disaster Human Services. As we gather here, we are united by a common goal to ensure that disaster human services are not only effective, but also equitable. We understand in times of crisis, the impact of communities can be profound and uneven. Our mission is to address these disparities and strive for solutions that ensures all individuals, regardless of their circumstances, receive the support and resources they need to recover and rebuild. Today's session is an opportunity to explore the complexities of achieving equity in our disaster response recovery efforts. We will explore strategies to identify and address systemic inequities, learning from pioneer practitioners, and discuss innovative approaches that can help us bridge gaps in services delivery. We are privileged to have a distinguished group of panelists who bring a wealth of knowledge and experience to this discussion. Their insights will help us better understand the challenges we face and inspire us to develop solutions that are both inclusive and effective. I encourage each of you to kind of think about and actively participate and ask questions if you do have any, and share your perspectives. Together, we can advance our understanding and making meaningful strides towards equitable outcomes in disaster human services. Let's move forward today with purpose and determination. A couple things I want to talk about first as we begin. I want to talk a little bit about the Administration for Children and Family. I want to talk a little bit about why equity matters to ACF. Couple different things. First and foremost, addressing systemic disparities is really important, particularly when it comes to ACF. When we talk about addressing systemic disparities, I'm talking specifically focused equity is not just a principle, but a necessity in addressing the systemic disparities that exist within our social services system. Many of the communities we serve face historical and systemic inequities that hinder their access to resources and opportunities. By focusing on equity, ACF aims to dismantle these barriers and create an inclusive environment where every individual has a fair chance to thrive. Secondly, enhancing program effectiveness is very important at ACF. Our programs and services are designed to meet diverse needs, but their impact can be diminished if they do not account for the unique challenges faced by different groups. One size is not a fit all. An equity-focused approach ensures that our strategies are responsive and tailored to address these specific needs, ultimately enhancing the effectiveness of our intentions and our support. Building trust and encouragement. When communities see that their needs and experience are being acknowledged and addressed, it fosters trust and encourages encouragement. By prioritizing equity, ACF strengthens its relationship with the communities we serve, ensuring that our programs are more inclusive and better received. Let's talk a little bit about the strategic implications here at ACF. Policy and program development is first and foremost. Strategically, ACF is integrating equity into every aspect of our policy and program development. This means designing initiatives that is explicitly aimed to reduce disparities, allocate resources equitable, and engage with diverse stakeholders to ensure our efforts are inclusive. Data-driven decisions is another thing that's really important here at ACF. To effectively promote equity, we must leverage data to identify and address gaps in service delivery. ACF is committed to using data to drive decisions, access outcomes, and continually refine our approach to better serve all populations. Partnership and collaboration. Achieving equity requires collaboration with a wide range of partners, includes community organizations, local governments, and other stakeholders. ACF is strategically investing in these partnerships to build a comprehensive network of support that addresses the needs of the most vulnerable. By centering these efforts on equity, ACF is not only advancing our mission, but also contributing to a broader societal goal of fairness and justice. We recognize that equity is integral in our success and to the well-being of the families and communities that we serve. Last, I want to talk a little bit about how do we allocate resources equitably. Let's think about the path forward. As we look toward the future, one of the most crucial challenges and opportunities we face is allocating resources equitably. This process involves more than just distributing funds or support. It requires a strategic, thoughtful approach to ensure that resources reach those who need them most and address systemic disparities effectively. A couple things that we want to address, and I'll go into detail a little bit later, but first and foremost, assessing community needs is really important. Data-driven decision-making, as I spoke about earlier, prioritizing marginalized communities, ensuring transparency and accountability. Thank you, Natalie. Fostering collaboration and partnership, adapting and iterating, empowering communities. Equitable resources allocation is a multifaceted process that involves careful assessment, data-driven decisions, prioritization of marginalized communities, transparency, collaboration, and ongoing adaptation. By embracing these principles, we work toward a more just and inclusive distribution of resources, ultimately advancing our goal of equity and ensuring that every individual has the support they need to thrive. With that said, let's dive into our discussion. First and foremost, I would like to introduce our panels. First and foremost, we have Natalie Grant, and I'll give her an opportunity to give her a formal introduction. Then we have Dr. Donald Dodgen. Then we have Carolina Luna Pinto. Then we have Dr. Liz Archie. Ash. And I'll turn it over to Natalie.
Great. Terrific. Thank you so much, Dia. We really appreciate you in your capacity. Yeah. Let's clap them up. And really appreciate you in your capacity as the Chief Equity Officer at ACF. And as Das Canistra alluded to this morning, it is infused in everything that we do. And we're glad to have you, and we're glad to have you really helping us get there. And part of the frame of reference on this issue for ACF is on the slides as you see in front of us. And this was discussed earlier today, but for those of you that are just joining us now, I'll sort of touch on some of the element areas that I know my colleagues similarly will dive into more deeply. We know that disasters impact individuals, communities, and households differently, right? No one is a blank slate. We are all a tapestry and constellation of our experiences across our lifetime and our community and all of those that make us who we are. And relatedly, disasters find us at our worst possible moment. And in that worst possible moment, we find that they can oftentimes just exacerbate that inequity, right? If I'm already resource constrained, how am I going to make those determinations in short order about where that resource goes if I can't do that very, very well on a day-to-day basis? And part of what we've come to understand at ACF and through our programs and through you, our service providers, is that sometimes the inequitable allocation of disaster relief and services can contribute to those ongoing inequities. And so what is the net effect of those sort of inequities in aggregate? You heard from some jurisdictional providers today, and you'll hear tomorrow, that there were multiple disasters that they may have faced in successive years. What is that impact if you already have a historically underserved or marginalized community? So when we take that as our frame of reference for the issue, if you advance to the next slide, we can come to understand how ACF is engaging with this issue holistically. Next slide, please. And part of our focus on establishing disaster human services equity came from the motivation that was driven by the leadership of ACF and part of the strategic plan in that strategic goal. It gave us a space to really explore this topic and what it means concretely to disasters and human service programs specifically. In addition, you see my colleagues on the dais here. You'll get to hear from them. I'm really excited. Is partnership. We were able to collaborate and dialogue and really understand what that meant for our work within the human services part of health and human services, and then also what that means across the federal interagency. And then I would be remiss if I didn't mention that we had really great technical resources, not only from DIA, previous Commissioner Schomburg, ASPE team, ACF teams, number of different persons and resources that helped us really understand the challenge that we have and the opportunities ahead. So what they challenged us to do was figure out what to do, right? What are you going to do? What concretely can we engage with and have as an output? So we recognize that to ensure that we have a level set, we need to have a common language, a common vernacular. And for us, it was defining disaster human services equity for ACF and what it meant across our programs and services. So defining it is one thing. Then how are you going to help people get there? How are you going to help them understand how to engage with it? So the next step was really defining and curating a toolkit so that people could know, okay, I recognize this is a definition. How do I approach it? And then finally, how do we communicate about it in simple ways through visual representation and so on? So those were the outputs that we really crafted here within OHSEPR to engage with the topic of disaster human services equity. Next slide, please. So as you can see, it's not the sexiest infographic, I will admit that. But what I will just offer is this definition, lots of words, but it was derived through conversation across colleagues at HHS, folks in industry, also folks that were service providers and academia. And what really was center here is community specific, to the point that Dia was mentioning, that the services we're seeking to provide are tailored and accessible, right? That they are culturally and linguistically appropriate to mitigate, it's supposed to say, not migrate, mitigate disparities in health and well-being to support that resilience, right? So if you really dig into this definition, you'll see that there are various areas here that we can deconstruct and really engage with through our program and service provision. What does accessible mean? And really calling that out and saying, is this accessible for everyone? And do we even know who everyone is in our community? What are we striving for in terms of resilience overall? Next slide, please. So then this toolkit is on our website. It hits on a few priority strategies, and I want to encourage folks to take a look at it because it hits on some of the key stepwise processes that you can undertake for human and social service providers to really start to engage with this concept of disaster human services equity. But I want to pass the mic over to my colleague and friend, Dan Dodgen from the Administration for Strategic Preparedness and Response.
That's us. Thank you, Natalie. Can everyone hear me? Yay. Oh, yeah. Applaud for Natalie. And I heartily endorse everything my two ACF colleagues have just said. They've covered so much of the ground. It'll allow me to go into a little bit more detail. 3 things. I want to tell you, what is ASPR? How many people in this room know what ASPR is? Okay, so most people do. Awesome. I don't have to say very much then. I'll tell you a little bit about myself and then a little bit about how we're approaching this issue. So ASPR is the Administration for Strategic Preparedness and Response, formerly Assistant Secretary for Preparedness and Response. We got to keep the same acronym, so that makes it really easy for people. You can just say ASPR and you don't have to spell it out. We are the lead for ESF 8, right? We've heard a lot about ESF 6 today, which is Mass Care Housing and Human Services. And of course, ESF 8 is public health and medical. So we're the lead for the public health and medical aspects of disasters. And that's everything from deploying people to work in medical shelters to running the COVID response for the nation. It's a lot, right? Because it's health and medical. I would argue, of course, that anything that affects people affects every aspect of their lives. It affects your health, it affects your service needs, and as a clinical psychologist, it affects your mental health too. And I think sometimes these divisions are a little bit artificial. So ASPR has a really big role in every disaster, but what that role is going to vary a little bit. Now, I came to ASPR through a sort of unusual path. Actually, I've been with ASPR since it was invented, discovered, authorized, whatever the right word is, back in 2006 after Katrina. I am a clinical psychologist. I come from the community. I worked in community mental health for many years before becoming a Fed. I worked actually in the child welfare system doing services for children who were victims of abuse or abduction. And that local experience, of course, got me engaged with a lot of local responses. I don't know where our California people are, but I actually was a responder to the civil unrest or riots, whatever you prefer, in Los Angeles in '92, to Topanga fires, earthquakes in Northridge. I've been doing this a long time, but always from the perspective of child trauma, which makes, I think, a nice connection with the work of ACF. And that anyhow brought me to ASPR, where I have been leading for many years different things that we do related to what we call at-risk individuals. Now, we use the term at-risk individuals because that's what's in our legislation. At-risk individuals is seniors, children, pregnant women, and people with access and functional needs. Well, you can imagine as we have faced a lot of disasters, equity includes a lot more. Those groups are super important for sure, but it includes a lot more than that. So when COVID came along, I think we realized that there was a lot more that we could be doing to address equity issues really across the pandemic. Now, prior to COVID, of course, we knew that too. But again, you know, legislation, policy, where can you focus your energy? So we did three things as we prepared to respond to the COVID epidemic. First, we made sure that we were being flexible to respond to the needs as they emerged. So much innovation happened during the COVID pandemic in the healthcare space in terms of equity and addressing the needs, because I think we all saw very, very quickly that the pandemic was unequal, right? In terms of who was most impacted, whose life was going to have the most short-term and long-term impact. It was unequal. So we had to be just very flexible, very innovative in addressing the needs of all the people of our nation, right? Second thing that we did was we established a policy hub for climate change and health equity. And the reason for that was that there was so much happening both in the climate change and extreme weather space and in the equity space that we needed a central focus for both of those things. And because equity is super important, climate is super important, but the nexus of extreme weather and inequity is extremely powerful. When you look at the impacts of hurricanes, wildfires, flooding, drought, extreme heat, all of those things have really significant disproportionate impact. So we looked at what that is, and we created a policy hub to make sure that we were addressing those things and that we had a plan across all of ASPR to make sure that we were addressing both the needs of all individuals in all events, whether it was extreme weather or whether it was any other kind of event like COVID. The third thing that we did very quickly as I wrap up is that we decided we need to look at our own house and see how we were doing. And I would encourage everyone else to do the same thing. So we actually did a baseline assessment of all of our programs just to see how are they currently addressing equity? What are we currently doing? How are we defining equity? How are we implementing procedures, programs, policies that will advance the cause of equity? And we actually have done a 3-year process, started with just our pandemic planning in the first phase. Second phase is all of our programs. And now this phase, we're actually looking at regional activities and seeing how we're doing at the regional level. All of it is to find out how are we doing with equity. I won't have time to tell you what we found, but it's been a very exciting and learning process. We've got gaps and we've got strengths, not surprisingly. Over to you.
Great. Is this on? Okay, great. So I'm Carolina Luna Pinto, and I'm currently the acting director of the Office of Minority Health at CDC within the Office of Health Equity. And so in addition to being the acting director, I also, within the teams that I work with, I also serve as a lead for emergency readiness and response and liaise directly with our Office of Readiness and Response. And we actually have some colleagues from ORR here. Raise your hands if you want to talk to them. Yes. And so, so I come to this, I just want to tell you a little bit about my background. So I come to sort of the emergency readiness and response world through working with migrant farm workers directly after hurricanes, providing direct services, emergency services. Health education was sort of a secondary thing almost, but, also, providing the basics, water, food, those kinds of things, and conducting rapid needs assessments to provide that information to FEMA. And this was in Florida when we had like back-to-back hurricanes, that sort of thing. And then at CDC, most of my emergency response work has been in Puerto Rico. That's where I met Natalie when you were in USVI. And so I felt like I was in emergency response the entire time there. So it was a little bit different each time, but first with Zika, and that was a big response. It did initially, there was issues, right? There was no Stafford Act, there was, things like that. But eventually a USG, coordinating group was put together. ASPR was there with us on the ground with the Puerto Rico Department of Health. And so, we made it through that. And then with hurricanes, right, Irma and Maria, that was huge. And so we worked together doing that work. And what I learned from my experience there, being sort of the boots on the ground in Puerto Rico, is that, and CDC's role at the time and continues to be, is to provide that support to the health departments for the public health infrastructure. And so while FEMA and ASPR and others obviously were working on sort of the life, saving lives, we were also looking at the public health system, which was completely down, right? And so the laboratories were, the laboratory capacity was down. There was no power, right? So I learned more about generators than I think I would ever have guessed, right? I mean, capacity of generators, what type of capacity of generators you need for, to run a laboratory in the city. So that sort of thing. So that's sort of where I come from. And I bring some of those lessons learned, to my current position. Right before this position, I did work with the Division of Preparedness and Emerging Infectious Diseases, which has now changed names. But a part of the work there was to, I immediately went into COVID-19, response. When I moved to that position, I think I heard in the panel earlier, be careful about like the dates or something when you start a new job, because when I moved from Puerto Rico to Atlanta, it was February 2020, right? So then right in March, things were shutting down, and, I ended up working the next 2 years being deployed at CDC. So doing that type of work, working directly with the states and local health departments, territory health departments, providing, on trying to understand what were their needs. So we put together what continues to be, and this is a lessons learned that I think we were able to keep, and within the Office of Readiness and Response, is health department liaisons. So they're sort of, similar to, FEMA and ASPR with the regional liaisons. Well, we have those, and we have been able to keep that and institutionalize that at CDC, and then be able to, activate them when we have these responses, right? So that's one thing that we've kept together, we've kept and institutionalized. The other thing that has been big for us is the Chief Health Equity Officer Unit, which was the first time that CHEO unit was established within a CDC incident management structure. And it was because of those inequities that we saw, not that they were a surprise, right? I mean, we knew this all along, but they were very, they were highlighted during that time for COVID. So that was established, and we are continuing now to institutionalize that, so that we have that in every response, especially the larger agency-wide responses, or where we have multiple centers that have to be involved. We want to have a Chief Health Equity Officer unit. So I'll leave it there, just pass it out to you.
Okay, this works. All right, great. Hi, everyone. I am Liz Ash. I am the Deputy Director of the Individual Assistance Program at FEMA. I am really excited to be here, and I'm very excited to go after all 4 of these wonderful human beings, because I think a lot of what they said are things that I was hoping to impart through my little talk here in the next 5 minutes. So one of the things I heard across all of them, and I will also commit, is a commitment to equity, a commitment to collaboration and partnership, to data-driven decision-making, and to lots and lots of listening. So today I wanted to tell you about some of the things that we have done at FEMA in the Individual Assistance Program. The Individual Assistance Program is the kind of human services part of FEMA, the people helping part of FEMA. So when a disaster is requested and the president grants a disaster with individual assistance, the Individuals and Households Program and the Community Services Grants are available to residents within the communities that have been declared. So that's basically how individual assistance works. Over the last 10 years in individual assistance, and especially over the last 3 or so, where our strategic plan in FEMA is instill equity as a foundation of emergency management, right? That's one of our strategic goals. We have done a ton of listening to disaster survivors, to states, to localities, to the media, to all sorts of folks have experiences with disasters and have feedback on how we can do better. And so we have been, as you see up here, doing a lot of listening sessions and interviews with disaster survivors. The President's Management Agenda has a life experiences working group that is looking at the experience of a disaster as being one of the most foundational and impactful parts of a American's life, and kind of diving into both how disaster survivors receive services from their government as a whole, and how that interacts in the context of our roles across the government through FEMA, through SBA, through HUD, through HHS. We are all providers, and sometimes we're not knit together as well as we could be. So I'm really excited to be here with you all and to kind of talk about this work. So some of the things that we've done recently, we did an equity sprint in 2021, where we really dove into everything that we could do within our policies in a 30-day period in FEMA to look at the access that people had to our programs and how we could reduce barriers to that access. One of the things that we found and worked on was non-traditional forms of ownership and occupancy documentation were getting in the way of disadvantaged communities being able to access FEMA assistance. So we changed our requirements on ownership and occupancy, which resulted in a whole lot more help to a lot more disaster survivors. We also changed the way that we calculate the value of your home or the square footage of your home to be eligible for direct housing assistance, which looked like it was a barrier to some lower income households being able to access direct housing. And we made some updates to our other needs assistance through that process. We also have seen that in the way that our correspondence works with survivors, that they're not able to understand some of the things that we're trying to tell them. So we did many focus groups. I'm sure that if you are working in a state where you have disaster survivors, the FEMA letters are something that you've heard about. We are committed to continue to work on those letters as part of a communication strategy to disaster survivors. It's a lot more about warm handoffs and about making sure that people understand what's next in their recovery journey, even if we can't provide that next step of service. And then finally, I'll talk about enhanced applicant services a little bit when we get to the question and answers, but we've made these massive changes to our regulations. So can you go to the next slide, please? So as part of listening to what disaster survivors have experienced, we undertook a pretty big regulatory update to the Individual Assistance Program. This became active as of March 22nd of this year. We've had 21 disasters declared for individual assistance since this became kind of a live regulatory paradigm. So there were 3 main tenets of what we were trying to do with this change. First was to establish new benefits for disaster survivors in their time of greatest need. So serious needs assistance and displacement assistance are new forms of assistance that are intended to be kind of a gap grant for disaster survivors right after the disaster happens, while rental resources are sparse. Displacement assistance is a flexible form of assistance that you can use for lodging, either paying back your grandma for staying at her house or staying in a hotel. The second is to cut red tape and expand eligibility. So one of the most negative survivor experiences that we have heard about is a old dependency on the Small Business Administration for some survivors, where they were unable to access forms of individual assistance without first applying to SBA, being rejected, sent back to FEMA, and getting assistance. We were finding that almost no one was coming back after being referred, and working together with SBA, we cut that dependency. So a disaster survivor can apply to both SBA and FEMA for assistance in tandem, rather than trying to do that handoff, which we know can be re-traumatizing and really complicated for disaster survivors. And then finally, we are simplifying the application process through a couple different parts of our assistance program, where we had asked for a lot more documentation than we needed. For example, in the continued temporary housing assistance, we asked survivors to demonstrate what their pre-disaster income and their pre-disaster housing situation looked like, which isn't really material after the disaster, right? That may not be what you have available anymore. So now we're doing more proactive casework with those folks to develop their permanent housing plan and updating that as more information becomes available. So we're really excited about these changes. And it's part of kind of a broader commitment to equity and emergency management and listening. So next slide, please. So as part of our commitment to doing better for disaster survivors, we have the Disaster Case Management Grant Program. We are working to both optimize our current disaster case management program and look to a future where we can modernize the way that we deliver the program. We are asking for feedback all throughout this year. And so this is my pitch to please go to sam.gov. We've got an RFI open asking for feedback for how we can do better as a community and as a whole to provide better post-trauma case management services and how that can help us all together provide a better disaster survivor experience. Okay, that's what I got.
It's great to really hear that, you know, we all take in consideration, you know, equity when we think about kind of, you know, certain communities. One of the things that you will hear me say throughout this is that one size does not fit all. And it's important that we truly understand that. One of the things that also, as Natalie talked a little bit about, my job is to also to make sure is that we embed equity in everything that we do, because for so long there has been communities that have been overlooked. Not intentional, but just overlooked because, you know, their voice was not heard. And so it sounds as though that we all are doing kind of listening sessions to really kind of hear their voice now and really make sure that we follow up with the information that we're hearing from them. So let's dig into a little bit of a couple questions. Liz, is it okay if I start with you? Okay, good deal, good deal, good deal. So let's talk about kind of resource allocation, particularly at FEMA. Can you discuss how FEMA prioritizes and allocates resources to different regions and communities? And also, what factors are considered to ensure equitable distribution, especially in underserved areas?
Yeah, absolutely. Thank you. So in the United States, disaster assistance is federally supported, state-led, and really locally executed, and it takes the whole community to get it right. In every disaster where individual assistance is authorized, we work really closely with the state or the tribe and the locality to ensure our programs are delivered equitably, especially for low-income households and other vulnerable populations. So one of the ways that that manifests within the individual assistance program is through an initiative called Enhanced Applicant Services. So this is a concerted effort, and we have done it in the past, but we really institutionalized it in 2022 and have done this process starting in 2022 for every disaster since. And the regional and field leadership works with the community or the county or kind of sub-county level jurisdiction to identify where there may be pockets of survivors that need additional help applying for assistance. And that proactive outreach, they do proactive outreach to disaster survivors in those specific areas or jurisdictions to kind of walk them through, do a little bit of casework to walk them through the process of applying, understand if they have unmet needs that we can't provide, matching them up with voluntary organizations active in a disaster. If there is a case management or a disaster case management program going on at that time, staying in touch with the disaster survivor to really work to ensure that their specific disaster cause needs are met. Because disaster by disaster, that underserved community could look incredibly different, right? So that is one part of how the field implementation of our individual assistance program is really focused on the specific community needs. I think the expanding ownership occupancy documentation that we did in the equity sprint. So so far that's served about 130,000 survivors with another $300 million of assistance that traditionally would not have gotten help from FEMA by not just taking the mortgage to your home as documentation. You know, we're taking a lot more than that. I think we're really proud of that, and we were able to do it within our own authorities just by looking at our policy from a different lens. So that's another way that we're looking at making sure that we are delivering our programs in the context of both the disaster and the community that we're working in. And then, like I talked about, wanting to get your feedback on disaster case management. I think our commitment there is to improve it so states can more quickly and easily access crucial funding and support to shorten recovery timelines for survivors, whatever that looks like within your state, and whatever survivors have those unmet needs. So we really, really want to have feedback from you all and learn from you what the challenges of doing post-trauma case management look like that could be supplemented by a grant from the federal government in a declared disaster. So I just thank you for having me here and for letting me be part of this panel and this conversation, because I think that we have a lot of opportunities to help more people together.
Thank you for that, Liz. Don't be surprised if someone from my team reaches out to you, because when you mentioned equity sprint, it's something that we at ACF we're actually doing right now with our program offices and stuff. So we're really trying to push, as I said earlier, really embed equity in everything that we're doing. And we're excited that we have probably every program office in our under ACF right now is actually going through an equity sprint.
That's awesome.
Yeah.
We would love to talk to you more about it.
Yes, someone from my team will definitely be reaching out to you. And I'm also glad to hear what we talked a little bit about kind of easy applications and grants, because one of the things as my job as chief equity officer, probably within the first week that I came on board, I said, let me read our grant applications, because I want to see, what these applications look like and, what are people dealing with. Now, I went to high school. I got an undergraduate degree, an advanced degree. I probably understood about 25% of what the application was asking. And so I'm glad to hear that not only here at ACF, HHS, and other agencies are really taking that in consideration, that we need to work on how we deliver the applications to these individuals, because once again, one size does not fit all.
Absolutely.
So I appreciate that, truly.
Yeah, thank you. And one of the things that we have done as an executive leadership team at FEMA is an exercise where we put ourselves in the shoes of the people that are applying for assistance or the people applying for the grants, and then give kind of feedback to the program office of what is it like as someone who doesn't know anything about the program to try and find what something means on a grant form, right? So kind of looking from a different perspective at what you, yeah, exactly. What it means and where to find it, Oh, put the disaster number. Here's where to go to find the disaster number. That's one of the things in our new DCM forms we put on the application so that people don't have to go and hunt for the information. But
Thank you for that, Liz.
Yep.
Dr. Dan, can we go with you now? Good deal. Let's talk a little bit about kind of strategic planning. How does ASPR, strategic planning, integrate equity considerations into disaster preparedness and response? And can you provide examples about how equity has shaped recent policies and initiatives?
Yeah, it's a great question. And I tried not to prepare too much because I wanted to sort of feel what was going on here. So I think a couple of things. Remember, I mentioned a minute ago, we created this climate and equity policy hub, really to focus on both equity and climate and the intersection. And we've actually created an action plan for the whole organization for both of these things so that every part of the organization has to commit to something that they can do to promote either better attention to addressing climate crises or equity or both. Most people chose to do both, I'm very happy to say, but we wanted to give a little bit of freedom because, you know, everybody is strapped for resources and personnel and everything else. It is in our strategic plan to address equity. It is in the National Health Security Strategy. So we have the big picture strategies are already out there. So one of the things we tried to avoid was creating yet another strategy. I don't know if any of you all are in government, you know, we have strategy proliferation, right? There's always a new strategy. So that's why I said to my team, we're not doing another strategy. We're doing an action plan. Take all the existing strategies, assume them as a given, and tell us what you're going to do. Remember, I talked about this equity assessment that we're doing. So that also fed into our action plans. So we've assessed where are we strong, where are we weak, what can we do better, what are we already doing great that we could build on, and all of that went into this action plan. So how do we integrate it into the strategy? It varies according to each organization, right? Like BARDA, our Biomedical Advanced Research and Development Authority, they promote and fund advanced development of medical countermeasures, right? So their strategy is going to be very different, right? So they're actually looking at partnering with HBCUs and with other organizations and historically minority serving institutions to promote a broader spectrum of scientists and researchers to look at how we develop medical countermeasures in the first place. So that's how that's integrated into their strategy. On the other hand, we also fund the Medical Reserve Corps. The state people, y'all know the Medical Reserve Corps, right? It's primarily a state public health asset, but ASPR kind of manages it at the national level. Well, what they're doing is very local, right? Because they are serving really as requested by their state health departments. So they do, you know, vaccine clinics, but they also do a lot of health education activities. And they've done some really cool, like the Stop the Bleed campaign, and some health education work around extreme heat, et cetera, in local communities, but with a focus on equity, right? Because a lot of the things that we've done, for example, with migrant farm workers, and we've done with certain communities that are historically more, as both of you are talking about, particularly Natalie, that tend to be most impacted by disasters. You know, I always talk about the triple whammy, right? There are certain communities that are more vulnerable to a disaster before it ever hits, right? Then the disaster happens. That's the second whammy. And then the third is the recovery period, applying for assistance, so much better, applying for assistance, and just the community itself. How do you support people in the recovery phase if you have the kind of job where, you know, you can't just drop people off at childcare, you know, between 9 and 5 and all those other things. So we're looking at all of these things to make sure that what we do strategically fits with the mission of each program office. So we're not trying to say everybody has to do this. Say, okay, this is your program office. Tell us how you can better integrate equity into what you do. I've probably used up all my time, so I may not have gotten to the rest of your question. I apologize.
No, that's fine. It's great that you kind of give them ownership of their action plan. One of the things, and once again, to kind of throw ACF out there, is that we actually have action plans as well for our program offices. But one of the things that I think is really important is accountability. So how do you hold those program offices accountable for their action plans?
I think that's a great question. And again, we did the equity assessment. We are actually looking at how each program office is doing. We're not doing a report card. We had to start with, where are you? Because some folks were much more advanced than others in some of the work. I mean, I think our recovery office that Natalie works with a lot has been thinking about equity issues a lot for a lot of years. Others have not as much. but we are committed to an ongoing assessment of the action plan. So it's all written into a metrics, it's all written in a table. There are timelines and actual measurables associated with each item. I will say others, for those of you who are in agencies who haven't done this kind of analysis before, the other thing we discovered is a lot of people are doing really cool things that just one individual program office just kind of innovated and did something really cool. And at the sort of senior level, we didn't even really necessarily know about because it was one person doing a really good thing. But by doing this assessment, we actually uncovered some really interesting things, particularly, we did a lot of the distribution of masks and PPE, as well as vaccines, test kits, et cetera, during the COVID pandemic. There was so much innovation happening, both at the federal level, but also at the local level. It is so good to unearth that and make other people aware of it. And I think that's probably true in everyone who represents a state. You probably are doing something really cool that other states could benefit from. And that's something that we learned. And hopefully somehow before these 3 days are up, we can maybe uncover some more of those things and get them out there so that people can discover there's really good work happening in this country, and it doesn't always reach, inside the Beltway. So that's probably more than you wanted.
No, thank you for that, Dan. I'm actually watching a cool show on one of these streaming channels, and I know that was not one of the approved questions that I sent to you, so I appreciate you kind of taking that question on and stuff. But thank you for that. Natalie, let's talk a little bit about community partnerships. Can you discuss the importance of partnerships with community-based organizations in enhancing human services during disasters? And also, how does your office work with these partners to promote equitable outcomes?
Great. Happy to dive into that. And as I am wont to do, because I'm a biochemist by training, I'm going to break that down a little bit. Because when I think about community, I can think of communities of place, I can think of communities of practice, I can think of communities of various forms of identity, right? And especially in disaster, we know that historically there are challenges in having representation of that community that has been impacted by the disaster. And that in and of itself can become a barrier to that service provision. And I'll just run it back really quickly. When I met Carolina and I was in the U.S. Virgin Islands, I'm Jamaican American, first generation, and my culture, being from the Caribbean, was more impactful because I understood. And when they saw me, and me broke out in my patois, right? Then they knew that I can have a different type of conversation. I can go there into the places and spaces that they might not otherwise feel either welcome or comfortable. So when we think about community, the first thing that comes to mind is, are we reflecting and representing the community's values, their interests, and someone that they can really open up to in that time of emergency and crisis? And not necessarily to be provocative, emergency management historically hasn't been known to be the most diverse sort of interest practice area. I see my colleagues sort of chuckling, and they clearly agree with me. But I think that's also an opportunity, right? And I know that across our different federal programs at the state and jurisdictional level, that there are folks that are junior in their career that are seeking to really come into this space and place. And part of what I would encourage is through that community partnership. We know at the Administration for Children and Families that we serve and support individuals, households at the margins and in crisis every day through our community-based organizations, through our national associations, through our state human service providers, through our county and jurisdictional human services providers. They are there. And it's incumbent upon us to recognize the strength that they have and how we buttress them to be able to provide that support to their community members as well. Because they have agency, oftentimes they just need support. And what and how that support manifests may not necessarily neatly fit into how our federal programs are designed. And that's what I think you hear from the panel themselves, is that we're listening to try to figure out, what do you need, right? You heard our colleagues from Hawaii, Joe, say the first question that I asked him, thanks, Joe, was what do you need? And I believe in that, because the focus is on you and what you see as the need, and then how we can best support you, because we're not here to supplant, we're here to support.
Thank you for that. Great words, because I think as we kind of go into these communities, a lot of these communities are already broken. And so it's important that you kind of do a couple of different things, that you build those relationships, build the trust, and kind of build upon that, and kind of, listen. You really need to say to some of these communities is that not that we're listening to you, is that we hear you. And when we hear you, there's actions behind that, actions that's going to be meaningful to them. So that's really important. And thank you for that. And working with communities that may not look like us, who may be a little bit different, who may have different needs than everyone else. So thank you for that, Natalie. Carolina, quick question for you. When we talk about health equity, how does the CDC address health equity in its disaster response efforts, particularly in terms of public health interventions and resources? And also, what specific initiatives are in place to ensure that all populations are adequately supported?
Okay, so there's two questions
Yeah.
there. So I think so a couple things is I think with CDC, I think the position that CDC really, as I mentioned earlier, is looking at how do we support the state and local territories, health departments and their infrastructure. And so we're really, want to know, like you all have said, what are the needs? How can we support locally. And so if we are invited, obviously, right, to come and assist and help, we will be there. And so those are some of the structures that we have in place to be able to send subject matter experts, right? Whatever it might be, if it's schools. I know with COVID-19, we had schools, right? Guidelines that were written up, for schools, but nobody really had worked in schools and doing contact tracing, right? So what did that look like? So that's where CDC was able to step in. And we've been doing this, for a long time. So I think that, having those ready, teams is one thing in terms of resources. Surge capacity is another thing. We found out obviously that, health departments couldn't do all of that work, right? They were shifting people to do different things, right? People who weren't, weren't contact tracers, we're learning to be contact tracers. But that's where CDC could also assist with surge staff as well. We also have staff that are embedded. I don't think enough staff, within the jurisdictions, but we counted a lot on those staff to be able to understand sort of the situation on the ground. So we have people built into the immunization programs, public health advisors. We also have epidemiologists in several states and territories. And so they, assist, on the ground, providing that help, but also a conduit to CDC to provide what's really happening and how could we be more helpful. I think that for Zika and some of these other, sort of more disaster, because Zika in a way felt like it was like a disaster, in Puerto Rico, we had to sort of expand a little bit what CDC was normally used to doing. It was more about vector control. We need to get mosquito nets, but maybe they don't use mosquito nets in Puerto Rico, right? So that might not be the thing to do in Puerto Rico, which ended up being a thing. People don't use really mosquito nets in Puerto Rico. But we couldn't automatically assume that we were just going to come in and bring in insecticide and spray it all over the island. That did not go over well at all either. So these kinds of things, I think having the people on the ground and being able to have that relationship ongoing in, the various states and local is really important to CDC. And I think because of that infrastructure and the relationships that we try to keep right ongoing, that's part of the infrastructure that we build in.
Thank you for that.
Sure.
Julie. Now, I think what we're going to do is kind of open it up to a couple questions, whether or not it's from the audience or from individuals online.
Yes, thank you so much, Mr. Harris. We do have a question that's come in from our virtual audience, and anyone can answer this question or speak to it. It isn't addressed to a particular person, but if you wouldn't mind sharing what your organization, any one of you, what your organization is doing specifically to incorporate LGBTQ needs into disaster policies. For example, California legislature recently passed Senate Bill 900, which directs the Office of Emergency Services to specifically establish the best practices that state and local governments are to use when addressing the needs of this community after a disaster. Thought I'd give you a simple one.
I can start, but I certainly don't want to be the only one to respond to that. I am a member of the queer community myself. This is an important issue for me. And I will say, in general, our record is not so good on this one. When you do assessments of sort of populations that are attended to in disaster and emergency preparedness, this population is universally sort of at the bottom. In terms of who gets attention, resources, just thinking in the planning. World Pride is going to be in DC next year, by the way. And so we're doing our best to ensure that we do a better job of planning for the queer community, because there's going to be 2 million extra of us in DC next summer. So it's an important question. A couple of things that ASPR is doing. One, we do have some things that we put out that are designed primarily for both emergency preparedness officials to be better able to prepare for the needs of the queer community in a disaster, but also for members of that community to think what they can do to be more connected to the emergency preparedness community in order to sort of think of how you can prepare your own community. This is a resource toolkit that's on our Tracy, that's our ASPR TA site, just TRACIE. You can Google it, you can find them pretty quickly, but if not, grab me at a break and I can tell you how. And we have put like every kind of resource that we could find. Again, not as many resources in this area as there are in some others, but we put every kind of resource that we could find in this toolkit with the goal, again, of helping emergency managers, emergency preparedness officials be better able to prepare, but also members of the LGBT community to be able to better prepare themselves and their communities. So it's a really good toolkit. We actually put it out on the anniversary, or it was something that we put together following the Club Q shooting. So it does have a little focus on mass violence, but I think that it really is applicable to all kinds of disasters. I can talk about other things, but I think that's the biggest one.
I'll let Net.
Oh, I was just going to mention that for us at CDC, kind of going back to the Chief Health Equity Officer unit, for MPOX, that was, we made sure that we worked with our colleagues from our center, that run the HIV, STDs, and tuberculosis units, and sort of going to their partners. And so those partners they've had for years and years and built in that trust. And so working, we had an advisor within the CHIO unit, and that really made a big difference. And so that is something that we've kept. I mean, or we would like to keep in our CHIO units, is to make sure that we can bring the subject matter expertise from across our agency and be able to have that as well to serve the population and use some of the practices that we know have worked in that community.
And then just really quickly from ACF's perspective, I know that in many of our programs, when we consider what is happening in the lives of the persons we serve on a day-to-day basis that is infused across how we approach disasters. I'll take one specific example with some colleagues that when we partnered with runaway and homeless youth, and understanding that within the scope of a disaster, to Liz's point, these youth may not necessarily be fully emancipated. They may not necessarily have documentation. They may have a distrust of sort of leadership officials and all of those different things. And we know that the Venn diagram of some of those intersectional pieces means that the LGBTQIA, 2+, Two-Spirit persons may be impacted in this same way. And we have to find a way to serve and support them. And part of that is just understanding what are their needs, what are their requirements, and really applying that human services lens to how we approach the disaster services that we provide. and understanding that some of the sort of trappings that we may put onto federal programs may not necessarily fully and adequately address how we can serve and support. That's one part of their identity, a very important part of their identity. And there may be these other factors that are built into our processes that prevent them from being their full selves, and also may also have some historical trauma in having them access the resources that we're seeking to provide.
And just to reiterate, ACF, that's sort of kind of my job as Chief Equity Officer to make sure that no populations are overlooked. And so I intentionally make sure that whether or not it's LGBTQ plus populations, rural populations that has been overlooked for so many years. And so my job is to make sure those populations are not overlooked with everything that we do. Yes, we'll open it up to you.
Thank you. Specific to parents in underserved communities who have children birth to 3 with severe disabilities. For example, infants who are dependent on supplemental oxygen and toddlers or preschoolers with autism. It is very difficult for them to be traveling to get assistance, and wondering if there's a plan, or if you already have started working with early intervention programs as a community connection, such as Easter seals.
Sure, I can start from the health side. I think the one program that I would encourage you, and then all the folks again who are state, local public health officials or state, local government officials who can connect to your public health, is ASPR does have this wonderful Empower program. You mentioned the folks who have the oxygen, and that program is a program that allows us, using Medicare data, to know basically where everybody in the country is who's electricity dependent for life sustaining, whether it's durable medical equipment or something that they have in the home. So I would really encourage the folks who are in particularly state level agencies, if you don't know about this program, find out about it, because it is one way to answer part of your question, which is it will help the state agencies, and then down below that, the county and the local government agencies, to identify where are the children as well as adults who are electricity dependent for life sustaining equipment, whatever that may be. So that's part of the answer to your question. I will turn to my colleagues to answer the rest.
Sure. And I do also want to give FEMA an opportunity to talk about their disability integration. And from just the ACF perspective, part of what we are seeking through this partnership with our colleagues here is an understanding of that experience, and understanding how some of those mass shelters may not necessarily be best situated, right? And that's part of the conversation that we're having, is to really bring the experiences of persons across various communities to the emergency management architecture, which has not necessarily historically been oriented to, and this is not a knock on FEMA, it's the sort of overall sort of aegis of emergency management, hasn't been person-centered, tailored and specific to those needs, because of just the approach has been, we have to save as many lives as possible as quickly as possible. Now there is an appreciation that is burgeoning within the industry, being led by FEMA, to say, hey, hang on a second. How effective are we if we don't actually understand what is in the universe and how we toggle our approaches and perspectives? So I think it's incumbent upon us as human and social service providers to make sure that we're engaging in that dialogue, so that they have awareness and understanding, because we know many of these communities and populations, and it would be on us as well if we're not bringing that information forward, so that we can, in partnership, really find a way to address those issue areas.
Yeah, I think that the understanding the specific needs of the specific populations is really a federal, state, local human service partnership. I think it's incumbent on all of us. It sounds like you have some data, right? The social service providers that are already helping these people before the disaster are probably going to know where they are and where those needs are met. And then to Natalie's point about our Office of Disability Integration and Coordination, taking that lens to every disaster and ensuring that we are working with the locality to understand where those most critical needs are. is really important. We also, in the individuals and households program, there are some ways that we can help replace durable medical equipment if it's damaged in a disaster and you're a disaster survivor, which doesn't help if it's incredibly needed in crisis, but after the fact, if it is, if it can be replaced, there's something that we can do to help there. So.
Thank you.
Thank you for your question. Looks like we have time for maybe one more question.
Asking for a friend. Our local emergency managers have a lot of different frameworks, and they get advice from the different functional agencies. And I can't pass up this opportunity because it's so cool to see FEMA, CDC, ASPR and OHSEPR in the same place. But with the goal towards bringing underrepresented voices to the table, each of your organizations offer local emergency managers a different framework for something I think is similar, right? We have community organizations active in disasters. We've got healthcare coalitions. We're putting together ideas about human service coalitions. And it's really confusing for local folks to try and figure out what they ought to do. And do you have any advice about how local governments and even state actors can reconcile the various guidance we get from your various agencies? We know we need to engage with our communities. We need to bring these voices to the table. It just gets tough to figure out what we should call it. Maybe we just have different t-shirts for different days. So I guess the question there is there a chance to reconcile the guidance and to make it multidisciplinary in how we approach our communities?
Thank you, friend, for that question.
I'll dive right in because I love it. I love a challenge. A few things that I'll hit off the top. One is that we all have different scopes of practice, and we're seeking the common language that bridges us across the same. I told you I'm a biochemist that's working in human services. My first days were very uncomfortable because I had to learn about the details of and dimensions of people and how human services worked or did not work. And in order for me to be of service to that community, I needed to go there. And in much the same way that my background is infused and I can have those conversations with CDC and say, hey, our COVID guidance, it's not connecting, or as the kids say, it's not hitting, right? It's not connecting to the populations that we need to serve and support. Let's talk about that. Let's find a way forward. And in the same way with our emergency management colleagues as well, because we all speak different languages that are connected to our scope of practice, and we have to find that bridge language that links us because we're serving and supporting the same people, right? While our funding and all of those other sort of pieces may not necessarily lend very easily to our collaboration, it's incumbent upon us at every level to find a way to have those conversations and to contextualize it in a way that invites people to a conversation, right? I'm always, and it's not just because I've known these folks for many years, and Liz is becoming a fast friend. Part of it is about just knowing and understanding where your pressure points are, what matters to your community, how do I best dialogue with them so that they can come to an understanding of what we see as the issue areas collectively. And that's really where the partnership comes in.
And I would just
Probably one more person to respond. Go ahead.
Oh, no, okay. I would just say, did you want to respond? I'm sorry. Just two quick things I would say. I'll be super quick. One is, don't forget about, for those of you that are state, local government, don't forget about the regional folks. ACF has its regional folks, ASPR does, CDC, FEMA. Often they're in the same building. They're better coordinated sometimes than we are at the federal level. So don't forget about them. They are, I think, much better able to help you navigate from the sort of state or county perspective, like how can we make all this work? So I think that just sort of from a logistical, applying for grants, looking at stuff, whatever, I think it's really helpful to work with your regional folks who can really walk you through stuff sometimes better than we can at the federal level. The other thing I would say that as we talk about equity, one of the things that I try to remind my staff is our job is to prepare for every person in every community for the kinds of crises that they might face, period. And I think as we get away from some of the terminology that in some places can become a hindrance to the work, or in other places can lead to further division and factions, if we can just keep remembering it is about preparing for every person. And I think sometimes if we have that mindset, it can help us to get around some of the other things. Now, is there language in every federal grant applicant? Of course, right? I mean, let's be real. But I do think that there are things that we also can do to facilitate the kind of dialogue that has to happen at every level and maybe get around some of the unnecessary impediments.
Thank you for that. Before we end, let's give it up for this panel. Truly a great panel. Thank you. Thank you. Thank you. And I want to say that hopefully the panelists are not going to run right after this session. They'll stick around because I know there's more questions out there and stuff. And so they'll have a chance to kind of answer your questions one-on-one if you do have questions. So my job is to wrap it up right about now. And so let's talk a little bit about what we've heard today. One of the things that I do want to reiterate and say that we all know that one size does not fit all. And what we have to realize is that we as organizations and programs have to be as flexible as possible when we meet these communities. And when I say meet these communities, that's what we need to do. Come meet them on their territory, their grounds, come meet them to where they are. Don't make them come to us. We need to meet them to where they are and really be able to help them. One of the things that I do at ACF is also kind of, everyone wants to say they want to have a listening session. But what I also kind of really direct those individuals to do is to make sure that you manage expectations from those listening sessions, because that audience, when you're coming to have a listening session with them, they have expectations. And so you have to be able to manage their expectations and manage your expectations. I tell them, don't have a listening session if you're not going to follow up with that group with actions within the next 30 days. Because you're wasting their time. And the next time you try to have a listening session, you're not going to have anyone there. So you have to be able to manage that. So manage those expectations. And with those listening sessions, I am a product of North Philadelphia, and I'm also a product of Head Start. And I took advantage of Head Start when I was like 3 or 4 years old in North Philadelphia. And what benefited me is that they had those wraparound services that my family was able to take advantage of, like LAHEAP. Energy assistance bills and stuff like that. And so I was afforded those benefits and probably would not be here without those benefits that I had as a young child and stuff. So once again, let's walk away understanding that, and I'm going to say it again, one size does not fit all. And I'm excited that these agencies and organizations up here are really embedding equity in everything that they do. And so we will not overlook those populations that have been overlooked for so long. Thank you. And hopefully you are walking away with some knowledge and some pockets of nuggets that you can kind of use for your agency as well. Thank you.
Let's hear it once again for our panelists. At this time, we'd like to conclude the webinar portion of the program. Of course, we want to hear from all of you. So please, if you wouldn't mind taking out your mobile phones and taking a quick shot of the QR code here to complete a 1-minute survey. That'll really help us with programming. In addition, we will be taking a 10 to 15-minute break before we break out into some roundtable discussions. We really want to hear from all of you. We hope to make it interactive. We hope to make it fun. If you have been sitting at your table for the majority of the day, we encourage you to stand up and meet someone new, and we'll get started shortly. Thank you.